Saudi Vision 2030, and lastly, to identify the processes to achieve the highest level quality through accreditation of nursing programs. I'm Dr. Joanne, and I will be one of the moderators for tonight's event. It is indeed our pleasure to have a very diverse group of nurses coming from the academe, from the practice and administration throughout the kingdom. We appreciate your attendance for tonight, and we hope that this evening will be a great learning experience for all, similar to what we had during the day one of this event. Before we start our webinar, we would like to provide you with a few ground rules for our virtual event. To make our session a healthy and productive environment, let's keep the following points in mind. First, keep your microphones on mute. This reduces background noise and distraction because microphones can pick up background sounds that may not bother you but may bother the speaker and other attendees. If you want to say something, please raise your hand and wait for the moderators to acknowledge you before unmuting. Again, I would like to remind everyone to please keep your microphones on mute. Second, be fully present and pay attention and participate actively, which means that you have to avoid doing other tasks during the event because distractions will also limit your learning. Third, be responsible in the chat box. Use the chat box for questions or comments regarding the presentations and be mindful of what you are writing. Think before you click, since reading your comments is not the same as hearing them. For any questions and clarifications, we would really love to hear from you. Please feel free to type your questions in the chat box. However, if you cannot access the chat box, don't worry. We shall run a live Q&A at the end of this event. So you may feel free to ask questions or clarify or even share experiences relevant to our discussion. Don't be afraid or shy to ask questions because similarly last night, our speakers for today will be more than willing to accommodate your questions. For our event evaluation, the link of the event will be sent in the chat box, and to be able to get the certificate, you have to accomplish the event evaluation. Again, those who have evaluated yesterday, please don't forget again to register to evaluate for tonight's event because you have to evaluate twice for you to get the certificate. When you are accomplishing the event evaluation, please don't forget to put your first name, middle name, and family name. Again, I will repeat that. Please include your first name, middle name, and family name, and an active email address. We hope these online etiquettes would help foster a good learning environment for everyone. May I also remind everyone again to please follow us on our official social media accounts to get real-time updates on our upcoming events. Follow us at KFU Comes Official for Twitter, Snapchat, and Instagram. Now that we've completed that, I would like to give the microphone to our dear head of the department, Dr. Benjo Brebenaria, to introduce our esteemed resource speaker for tonight. Dr. Benjamin? Dr. Benjamin, you are on mute.
Okay, so I didn't realize that I'm on mute. Well, anyway, I just would like to say that it is such a grateful evening to everyone, and indeed a pleasure to be with all of you this evening. I am so happy for us to be able to learn from the leaders that we had last night. That includes Dr. Ali, and then we had Dr. Bander also, and Sir Nafi. I'm just so amazed with the diversity of experiences that we had yesterday and we have in this kind of event. Students were empowered. I can see that from the event yesterday, and future nurse scholars, that includes our master's students as well. They gained some deeper insights, particularly in the discussion, and also the nurses from the different regions in Saudi Arabia within the country, they are also inspired. So I can say that this is such an inclusive group of nurse leaders, future leaders, and aspiring leaders for us to acquire some wisdom. So Before I start the event, I just would like to interject some of the reflections that I had since yesterday, because since the COVID-19 pandemic, we have been challenged and our limits have been tested, and so many nurses lost their battles. There is really this what we call huge amount of blood, tears that has shed, and but there's just one thing that I can say to my fellow nurses who are, in spite of the difficulty, they are doing their best so that they can use their power to execute the highest level of excellence and quality to their patients. So I just would like to express in behalf also of the entire Department of Nursing and also in behalf of our Dean, Dr. Abdulrahman Al-Sultan, we would like to say thank you to all the nurses for inspiring us, or nurses like us for inspiring us, and thank you for sharing your stories that has continued to empower so many. And most especially, thank you for showing us your grit. So for breaking boundaries within yourself and for overcoming all the hardships and pain. And as nurses, you still keep on shining and inspiring all of us in our profession. With this, we are truly and deeply grateful. And we thank you for infusing joy in our hearts. So to open this event or formally open this event, always remember that you are braver than you believe, you are stronger than you think, and loved more than you know. So I can't wait any further, so I will have to introduce our speaker. Our first speaker for tonight is a global healthcare influencer. He is a transformational evangelist and a visionary leader. He is an accomplished healthcare executive with profound insights and experience, an innovative leader with proven track record and results in all aspects of hospital management and healthcare investment strategies. He has built valuable ecosystems across diverse financial and operating models around the world, and he has led the healthcare industry as a key opinion leader in many areas of the business. Currently, he is the president and CEO of the Makkah Healthcare Cluster, which is a division of the Ministry of Health of Saudi Arabia, entrusted to drive the healthcare transformation in the Holy City and the Western region of the kingdom. Honestly speaking, just by looking at his body of work, I'm so amazed. It's breathtaking. If you will ask me, I mean, how I wish, and especially for aspiring healthcare leader like us. So he is involved in the building of particularly the National Transformation Program, a part of the Vision 2030, and Maca Healthcare represents 92 healthcare assets with 19,000 employees. And on maturity as an accountable care organization, it will be adopting a sustainable integrated provider network to empower patients with accessibility through the Maca Healthcare Plan. What more can I say? We are truly proud and grateful to get to listen to his narrative of success. Let us all welcome Dr. Dilshad Ali.
Thank you. Assalamualaikum warahmatullahi wabarakatuh. Good evening. Thank you, Dr. Benjo, for the introduction. It's very lengthy. In its essence, I think all of us are partners in the entire journey. And it's been exciting for us to be working on this transformation for almost 2 years now. And as you mentioned earlier, we've been also going through a great challenge in terms of managing COVID-19 when it first started. But with God's grace, alhamdulillah, we've managed to come through that, and Makkah is now fully open for pilgrimages and for visits globally. And as we speak to people in the cluster and around when we share our experiences, the reopening of Makkah itself has been something for us to celebrate in terms of a success. So I'm going to basically share a little bit of the strategies that we have and how we've set out to position the cluster as part of the first 5 clusters in the kingdom who look towards transforming healthcare regions. Subsequently, I think my colleague Dr. Hamatik will share into deeper insights of the nursing advances that we've made and the success stories and how she's been working on the transformation side as well. So if I may share my screen, I'll just then basically speak on the journey itself, or how we've set up in terms of running the cluster right from the beginning. So as we've looked at the journey itself, now we've built a 5-year plan for the cluster, and again, the cluster, as you said, has 93 now, not 92, because we've just kicked off another primary healthcare center in the last month or so, with a large span of about 500 kilometers north to south in terms of our coverage area, with furthermost being around 480 kilometers from the center of the holy city itself. Now, with this insight, and of course, looking at Mecca itself being a city where every Muslim in the world aspires to visit and will visit one day, in terms of their religious obligations, if we want to call it, that it's basically receiving a whole transient global population every year. So taking that into consideration, we looked at how we would want to position Makkah, and the only way for us to relate this to what happens in the city from a pilgrimage perspective and being the reference point of prayer and direction for Muslims around the world was for us to really position it into an aspiring global healthcare system altogether. So essentially, the point taken was that with such a diverse range of geographical span, and of course, with the diversity that we celebrate in Makkah itself, we looked at basically how to create a hub and spoke model that would integrate right from the frontal side of digital care, then looking at home healthcare systems, and then moving into primary healthcare, secondary care, tertiary care, and quaternary care, which is the medical city, as being the continuum of care for Mecca itself, incorporating digital, and then looking at how we can position ourselves in terms of being a hub in the Western region. So we've obviously now Mecca's very, very special in the sense of how it's positioned itself, even geographically. We see a population of 2.5 million people within the region itself, which is Mecca, but we see an influx or drainage of about 8 million people who use services from the healthcare facility that we have, which are local population within the Western region. And then you have a plus 15 million transient population who are exposed to our healthcare system as well. So it gives us a lot of challenges in the sense of how we manage the system and how we manage patients coming through the system. And apart from what we have as our non-Hajj hospitals, we still have another 8 Hajj hospitals which are seasonal and run during the Hajj period between Zulqaidah and 15 Zulqaidah and 15 Zulhijjah according to the Hijri calendar. Distribution-wise, we have 51% Saudis and 49% non-Saudi population in Mecca, which makes it a good 50-50 balance in terms of the diversity itself. And as of now, the post-COVID growth rate has increased a little bit to 3%. So we're seeing a very healthy population growth with a lot of challenges or a lot of opportunity for us to enhance the system. So 10 hospitals spread out entirely over the region. If you look at our statistics, we're below national averages in terms of bed to population ratio. We're below the number in terms of physician to population, and also we're not really optimal on the nursing side. However, we still have in the system 6,000 nurses who work on different areas of the care delivery. And of course, Ilham will share this in terms of how we distributed our nurses, and she'll share success stories about how we've managed to return nurses to service from non-nursing roles as well. So as with all clusters in the kingdom, or all transformational entities in the kingdom, we derive our strategies from the Vision 2030. There's a little bit of a typo here, so it's 2030 in that sense. And 3 key elements of the vision, obviously, as everyone knows now, is a thriving economy, where we'll be moving away from the oil dependence and move towards non-oil economy in terms of balancing the income of the kingdom. Then obviously to build an ambitious nation which consists of citizens or nationals who will build the kingdom and make it one of the world's most successful countries. And we see that happening really fast with the Vision 2030 being achieved. And of course, the last part is the vibrant society side, where wellness, spiritual, mental, physical, emotional, and psychological health would be the key driver towards how we create a healthy society. And then, of course, increasing life expectancy dramatically by pushing towards a preventive healthcare system that works to create a better status of health in the kingdom. Now, when that vision is taken, we basically cascade downwards to the quadruple aims of MOH, which everybody is well aware. How we've looked at the cluster itself from a thematic perspective when we started with our journey was to look, firstly, most importantly, is to address people. And people here being not just patients, but looking at the entire ecosystem of human capital itself that we have in the cluster, addressing people's needs from an employee satisfaction perspective, employee health, and then translating those values into how we look after patients and how we look after guests who come to the region in terms of their needs for care. Care, as I mentioned from the beginning, is a full spectrum of continuum of care, which starts from the home of the patient, from the cell phone, from the accessibility point, and all the way till they get into quaternary care, where we look after them in terms of the complexities that they see. Now, as with every transformation, one of the key points, and this is a word which obviously has been used over and over again, and you cannot escape from using the word sustainability. So while we design and build and envision the future, sustainability will be a key component into making sure that we run through the systems. And as I've always said, transformers build systems for the future and to create legacies that would work even better than what we've designed it to work for the present. Digital, as we know, it plays a very, very critical role in the delivery of healthcare. So that's a major push. And at this point, we basically already rolled out a plan, or we're already rolling out a go live exercise of standardizing all our PHCs with the same HRS system, so that patients can walk through with a common ID and get treated with one EMR across the cluster. So that's a major achievement, because we will be rolling out 83 new HRS installations in all our PHCs within the next 3 months, inshallah. Again, as I said, accessibility is a point of major consideration. People need to reach healthcare from their doorstep, and being the major activity where Hajj and Umrah is a focus, we look at how Hajj and Umrah can be transformed from a healthcare perspective and made more efficient, where accessibility, opportunity for the cluster to also look at being able to attract patients from abroad, not just emergency, but elective as well, as being part of the business activity or the operational activity of the cluster. Right, so a couple of key words when we look at the narrative itself, and of course then Ilham's going to just dive into all this that we were discussing. Efficiency is one of the key areas, because again, financial sustainability, financial efficiency is eventually going to be a real core factor of how we run the healthcare system and the transformation. Patient centricity, as we've been always discussing in major forums, in a lot of thought leaders coming out, that is basically a focus as well. Digital, the stakeholder engagement side, which we feel are external, internal, bottom up, top down, horizontal, is very important, because we have to address all the key agendas which impact Vision 2030, and not just healthcare alone, but the peripheral, indirect and direct strategic agendas of all agencies that are involved towards the mobilization. So as we move along, as I said, the people factor is key, and without addressing people, it's not going to be possible for us to transform. And now moving towards a business-centric environment, not for us to compete with the private, but for us to look at how we can run it as a professional outfit that looks at outcomes, return on investment, and look at giving the maximum value back to the patient in terms of a value-based healthcare system is key for us to achieve. Behind all this, would be measuring how well we do it. And performance management is a key area of how the cluster runs. We have a dedicated performance management unit that looks at the central database, where decisions today are made purely on data-based or data-driven touch points, which allow us to basically back and justify our data before we make a decision. So we'll basically skim through. I think where we are in terms of limitations of the system, obviously these are very, very common to every system that we look at in terms of where change is. A lot of focus is on population health, because we really need to look at our population and start registering them and understanding demographics, and then carve out care plans and models of care plus pathways that fit specific segments of the society, delivering targeted healthcare initiatives or even interventions at that point. Financial management is a key driver where we need to do this. So there's a lot of work to be done on the financial side. And I think, again, with all changes, we'll have to look at the processes, systems, capabilities to ensure that whatever we set out to do for the future is founded on solid ground for us to be able to standardize and to make efficient as we move along. Okay, so the roadmap, very clearly, this is the last slide I'm going to speak about, because Ilham is going to take over and we'll give her enough space to speak about nursing. Where we are today is we're treating sicknesses. We're seeing more outcome-based care with patients flocking to hospitals and not really going to primary healthcare, because still it's a very disease-based system, and a lot of infrastructure is being paid for out of pocket by the government. And then, of course, it's still very focused on provider-centric, and we have a lot of talent imbalances within the system. Within the last 2 years that we've looked at how to run the system, obviously wellness is going to be a key driver here. We've been managing this pretty well in terms of pushing well for patients or for the community, pushing back about 65% of our outpatients into the primary care community-based healthcare system, and then zoning the cluster to make sure we have 3 networks of care. Because of the large size, we distribute care in 3 zones within the cluster itself. One key driver behind all this is to start engaging with the private sector, and we're fully engaged with them. We have around 17 projects that we've kicked off with the private sector to look at different sectors of provision, support, facility management, revenue cycle management, and even some of the areas in diagnostic and teleradiology as well. Again, decentralizing is the key behind all this. And obviously now the capability building, of course, is a major part of our drive. We've in fact just launched the primary physician or family physician academy just 3 months ago, where Makkah will produce family physicians for its own consumption, and for us to reposition family medicine into a frontline practice, and then empowering nurses to go along into being case managers and case coordinators as well. In 5 years, hopefully we'll achieve our whole objective at least midway. And we've always said that this transformation is going to be for us to calculate, to plan, and to roll out within a space of time, and making sure these are sustainable. So we'll look at a society which is empowered with their own healthcare, and digital has to play a really strong role in this, and of course patient education. Integrated healthcare services which run along a continuum of care. We would be expecting to see in the next 5 years or so that we have a very good partnership with the private sector to offset what we have in terms of disease, number one, and secondly, to look at smart investments where private can basically contribute to the care of the region as well. And then moving from outcome-based to value-based healthcare completely, moving from patient-centric to person-centricity, so where that's personalized care comes in, instead of just looking after a disease and a diagnosis and a patient, we look at the holistic care where a person is going to go through a system of care that allows the person to be profiled and for him to be able to understand how he should look after himself from a healthcare perspective. So I guess putting this outlay in terms of how we're moving towards the accountable care organization system, plus at the value-based healthcare model that we want to convert from outcome-based, would actually give nursing a real frontal role in terms of how care is delivered, empowering nurses to do more. Again, fixating right job, right skill, right position, and then trying to minimize non-essential nursing roles to be moved into ancillaries and support services, which are non-nursing. So we optimize the nursing profession and professionalize the system with a very strong nursing leadership and a strong nursing workforce. Again, thank you so much for inviting me to share my thoughts. And I think Ilham will take over from now and, of course, give us more insights into how she's been managing nursing in the cluster for the last 2 years. Thank you.
Thank you, Dr. Belcher. Thank you.
Bye.
Yes, Dr. Benjamin.
Thank you so much, Dr. Ali, for that presentation, and I'm sure that the listeners and the nurses who are watching the presentation, they are learning from what you have presented. It's kind of innovative, as I said, because value-based healthcare is a healthcare model that really maximizes everybody's potential, so including the society. So there are so many things by looking at the figures, but of course, a part of this presentation also is for me to introduce our next speaker. And honestly speaking, there's so much more to say as well because of her impressive body of work. And she's a transformational leader and currently the Chief Nursing Officer in the MACA Healthcare Cluster. She was a nursing service consultant as well and the Executive Nursing Director for Professional Development and Quality in E1 Cluster. But what is actually interesting about her body of work is the length of years that she has devoted in her dynamic career in the nursing education field. So she graduated from King Faisal University and a master's degree also in Northeastern University in Boston, United States, and a PhD in nursing in George Mason University in Virginia, USA. And she has held several positions in nursing services and, as I said a while ago, academic leadership. She served as the Dean of the College of Nursing, both at the Imam Abdul Rahman bin Faisal University, formerly known as the University of Dammam, and as well as King Saud bin Abdulaziz University for Health Sciences in Al-Azhar. So there's so much more to say in terms of her body of work, but I would like to mention something important about her leadership. For her, some of the important core values that she believes is the importance of honesty and empathy in leadership. And she believes that mentoring, coaching, and empowering young nurses to become leaders, and she takes pride in the hundreds of nursing students that graduated under his leadership. So to discuss to us nursing transformation in MACA Healthcare, let me call our second speaker, Dr. Ilham Elatik.
Good evening.
Good evening, everyone. Assalamu alaikum wa rahmatullahi wa barakatuh. Wassalatu wassalamu ala Sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. Ladies and gentlemen, it gives me great pleasure to be here with you all in this conference. I would like to thank the organizing for their kindly inviting us to share our journey and experience. And it's not easy to speak after a transformational leader who have a vision and was one of the first who in transformational thought about investing in nursing and how important that nursing should be on the strategic level. And this is what set the stages for a lot of important milestones in the kingdom that we are taking in transformation. We will share with you, Dr. Dilshad had mentioned a lot of component of the nursing aspects in the nursing transformational. And I'm here with you to share with you our journey, which I believe we've been very blessed and very lucky, and share with you those blessings during this past 2 years. We are looking that this journey would be a very good start and ground for the future of nursing in Saudi Arabia, inshallah. First of all, I would just like discuss aligning with whatever Dr. Dilshad has been, now presenting to all of you, the mission, the vision, the values of all the nursing departments. It's all aligned with Makkah healthcare vision and the transformational. So we are all in one, looking at be in Mecca to be recognized globally for providing excellence nursing care services. And also we are looking to be part as a healthcare providers in an integrated healthcare services to really meet the vision for the country by making center care and providing healthier communities and with cost effectiveness as well as high quality of care. Those are, the values that we share among nurses, leaders, and champions in Mecca. Those what they felt that they are passionate about. Passion was the center of it. Passion and empowerment, integration, innovation, credibility, and also inclusion. To give you just a small feedback on the demographic for Mecca healthcare, as mentioned before, it is around 7,000 nurses, around 6,000 nurses. The screen is frozen. Okay, sorry. So we have a very good percentage of male nurses compared to benchmark internationally and also nationally. And we have 77% of the workforce as female. The total of all the nurses in Mecca is around 5,931. They are 51% of them are Saudi and 48 are non-Saudi from a variety of countries. Almost every country is like in Mecca nursing. So really it represents a very diverse workforce, at the same time providing a global healthcare for pilgrims, for Umrah, and serving Mecca region. The distribution of nurses in Mecca, as you see here, the majority of our nurses are in the hospitals, inpatient. We have a high number are in critical care areas. We have 900 in PHCs, and as you see, other in different sectors. For the diplomas, for the master prepared, we have 2 PhD and 107 masterly prepared among Saudis and non-Saudi. The majority of the total of nurses are bachelor, and we are working also on the diplomas to really bridge them and support them for continuance of their education. In terms of Saudi and non-Saudi, we have the majority of the Saudi are diplomas. And as you see here, majority of the Saudi for master level is 44. And there is, as you would see, we put based on these demographic strategic plans for the 5-year, how we are gonna upscale our nurses and provide them supportive education to meet the requirement for the transformational and to meet the requirement for patient safety, high competency professional nursing. This is the leaders of Mecca cluster, and to be honest, sorry that we are blessed here in Mecca that we have great support from upper management, from the CEO, great belief in nursing. Our belief, to see that nursing as a healthcare professional now in transformational is more integrative and more working, mentioned bottom up and top bottom approaches and horizontal. So to work together as a healthcare provider in transformation collaboratively and horizontally, this is a step that we see it's growing day by day. This is our journey for the nursing. Since we started the last 2 years, the first year was about gap analysis, assessing the current situations, looking at the structures available. We did a lot of awareness and we did a lot of revision in those, and really we went to the front line, to the bottoms, with the nurses, with the head nurses, speaking about what do we want to achieve in nursing and what would transformational mean for nurses. After that, we started to look at standardizing those processes, standardizing structure, standardizing job descriptions, looking at what we have and trying to look of existing best practices and share this. And of course, if I'm speaking now not on my behalf as a leader, I'm speaking on the behalf of each leader of nursing and champion in Mecca, which they really have benefit from this think tank and this coming together and supporting each other and sharing the best practices among each other. And this has saved us, as you see, in a very short time by working together, and not only working together, we are learning in the transformational every day. We learn together, we share our knowledge, what we learned, and that had really brought a very good grounds for moving forward in our ambitious healthcare transformational plans. From 2021, now we are looking at all our action plans, our projects that we started top bottom to now look at how we're gonna really make more awareness, fill the gaps, implement those plans, and really document those sources of evidence. And as we all know, the journey for excellence and even the transformational, it is a journey, and we are on the track, and we look forward for this light in the end, inshallah. The operating structure and governance that we utilized, actually all nurses are very aware about the magnet model and the importance of having shared governance for decision making, and really the impact of having a shared governance for nurses really have a lot of evidence in the literature that really it retain nurses in the clinical areas, retain and attract nurses. And this is one major thing in the gaps that we want nursing to be on the bedside, to be on the clinical, and to have a voice, and their voice are contributed in the decision. So really building those councils on a system level, we took it very step by step. We only formulated the 3 important councils on a system level, which is quality, professional development, and research and evidence. And later on in this stage, we're encouraging the unit-based hospital governors, so to ensure that nurses' voices in the unit, in the middle management, is really, we have a system and it's integrated, and we have processes how decision is made in nursing. 2 strategies for really bringing down our initiative. We had a group for one on the level of the strategy, and the other group was implementing those strategies. It's like a steering committee and a team and an implementation team. Our perspective for the future, what do we want to look at? And as if you see those perspectives are based on the best practices that we all know about in nursing. One of them that we should have nursing leadership programs, succession planning, because it's so important in retaining and attracting nursing, and even in the transformational journey. The CNOs and nurses are participating in credentialing processes. The organizational structure in the hospitals and in areas that is practice, nurses do have control over the practice in the majority of the area that nurses practice in. And the programs that we are implementing, such as shared governors, peer review, other component, it will, we're piloting it from now to 3 years and really developing it further. All nurses are really familiar with the component of nursing excellence concept, which is shared governance, decision-making, leadership support, also educational support, standard for practice, professional practice model, care delivery involved in, which is called MOC, and the evidence-based practice. So we create a more scholarly clinical practice that can really influence patient outcomes and satisfaction and quality of care. Also, nurses already in Mecca healthcare, they are part of committees, part of council, patient safety, risk management, all those committees. We have a participant, and they are encouraged in majority that is related to clinical practices to have a participant from nursing. The peer review evaluation, we are gradually now building the competency for the leader, and we are looking for next years to implement peer evaluations. Professional practice model already have been started in Mecca, and we are taking those components to fully disseminated and inculturate those nursing, very important aspect that's been identified by Mecca nurses. Patients and their family are integral part of the healthcare. Staff nurses are involved in decision-making through the governors, unit councils, so they have a clear mechanism of decision-making. Of course, action plan already we have started in terms of patient satisfaction, nursing satisfaction as well. Those are all sources of evidences that we have started building it from the beginning of our journey. Of course, we have accomplished a standardized preceptor framework, and also looking now to kick off the residency program to ensure the next generation of nursing in the cluster. What does it mean for the patient? Of course, shorter stay, and we have seen the impact of shorter stay in the ICU with the initiation that, with the COVID. As you all know, Mecca was really in a very big challenge with the cases of the COVID. And one of the things that we have observed when the CEO have implemented a structure horizontally among all the head nurses in all the hospital for ICU, and dive deep into how we're looking at the documentation of nursing. And we did standardize the documentation of ICU nurses. We have noticed that head nurses of ICU had really impact on the shorter stay of ICU patients. And some of those leaders are writing a case study in really illustrating how can head nurses influence shorter stay with proper documentation and proper nursing care. Increasing stability in care and positive outcome, enhance patient experience and confidence level, and lower mortality rate. Of course, for nurses, it does mean increased job satisfaction. And honestly, we cannot just like every time we lose the nurses in our hospitals, we have to go and get the nurses and then we lose them again. This is not sustainable if we didn't start really looking at what is making nurses leave, whether they are national or not national, non-national, and looking at increasing those job satisfaction and to look at more sustainability in the future. Of course, this will impact their turnover, increasing in retention and recruitment as well. We're looking that it means also decision-making will be more collaboratively at the bedside. So the Nursing Excellence Initiative was based on best practices. Like every other model in the model of care, it was generated on best practices worldwide. Nursing also picked up the Nursing Excellence model, which is the magnet, which is one of the best practices internationally recognized for nursing. It is aligned with the PAHI requirement and international accreditation bodies, and also based on the SWOT analysis and the recommendation that we already know from leaders and conferences where we want to go and head in the future. It will provide the platform for integrating the model of care and achieving the ACO, especially that nursing workforce represent the largest professional healthcare worker in the hospitals. And also it will achieve the pillars of Mecca healthcare that Dr. Dilshad just mentioned. You know, as we mentioned before, the approach top down and bottom up, and really engaging the frontliners in the whole process as we go, building teams on the ground, was one of the major things that we started right in the beginning. This was really at the beginning time consuming, you know, we faced a lot of resentment, but, you know, now we can see that, you know, we can see the light. And to be honest, we can see the light because of the shining star of those champions. Nurses in Mecca are like bringing this light, and you know, the sky is enough for all of them to show their voices, to show their work and show their voices. And here we are sharing with you the voices of those nurses and their great work for the past 2 years. So our approach was very transparent, passionate, open, engaging, you know, learning rather than blaming, empowering. Building the trust was the first thing we did, because we know very well, anybody of you that worked with the nursing workforce, we have a lot of international shared environment issues, and we have been trying, you know, to overcome those issues we have in the environment, like bullying, like, you know, like not trusting, being suppressed, all those issues we have built it. The first thing we built is the trust and sharing our knowledge, and after it is teaching, coaching, and learning together. So this is open channels, more transparency in the environment, as well also, you know, quality of nursing leadership. We strive for high examples, and, you know, boosting engagement through huddles, regular meeting, workshop, seminars. And today really we were fortunate, we had great sessions and engagement with the CEO, empowering all those nursing champions, and workshop and session that really shares the vision of the transformational and what's happening. And what do we need to do in nursing is bring them to the table of the decision. You know, it's going to take time to build those capability, but we have to trust them. It's a great investment. It will pay back, and, you know, give them that space where they can contribute. Those are, you know, in summary, those are our initiatives. In the beginning of last year, it was 12 initiative projects under 3 initiatives. And for the next year, we are looking more at the lessons learned and more enhancing our project that we started and continuing the implementation throughout the 600 nurses. Our champions now reach 100, alhamdulillah, and those champions are the leaders of transformation, that they really gonna spread the knowledge and take that burden, take that role. This is as all of you know, this is the model. And if we look at those components of the model, we touched in most of the initiative, the majority of the basics for those components that we know it is very important for best practices. So we kept initiative under a clear framework that is gonna bring us all on one vision. This is an illustration of how all our project is aligned with the best practices in nursing, aligned with the gates of what the ACO, accountable healthcare, and the requirement from the holding company and the Ministry of Health. These are the champions, the directors, as you see from PHC and hospital are, you know, one of our main champions, but our champions for the nursing is involving frontline nurses, everybody who have the talented in different kind of councils that is really reaching now 70 members. We accomplished a lot of the initiative and we cascaded projects to the hospital, and we are continuing after the lessons learned to cascade and the implementation with the awareness and addressing all the gaps we are facing. This is our awareness visit. To be honest, the majority of the nursery leaders are more on the ground. The theme, we are all in Mecca, more on the ground, hands-on, and so many huddle, regular meetings, awareness, and this is just a learning process non-stop. A lot of acknowledgement and sharing our success, celebrating our milestone as we go. And thank you so much for listening. I came to the end of the presentation. I hope this was giving you an insight of the journey that we had for Mecca nursing during the transformation. Thank you very much, and please feel free to ask any question. I'm here to answer. Thank you.
Dr. Elham, thank you so much for that presentation. I'm so amazed. We are so gratified to be listening to your success story. It's very creative. It's very imaginative. You seem to, all of you there, like started a revolution of excellence in your region. And especially what struck me all throughout your presentation is when you talked about the guiding statements and really seeing passion as one of the core, or the core. So that's actually something that struck my inner being, because reigniting the passion among the nurses who are working with us is just really one of the key ingredients to excellence. And also another thing that I can still remember from the presentation is when you talked about inclusion. For me to be able to hear that word or saw that word in your presentation, being a part of the core values, I think it's so contemporary. I mean, it's a concept on how are we going to work together as nurses in spite of the differences that we have in terms of our thinking, in terms of our experiences, our education, or where we came from. And another thing, I actually learned a lot from it. So you mentioned also about shared governance model and on how this kind of model is really important in practice and actually even in education, because the voices of the nurses, particularly those nurses who are in the front line, is hugely important. And coming together, helping together, succession planning, nursing excellence champions, learning than blaming. It's like a growing organization that practices different kinds of culture, and maybe just culture is one of them. And one of the most important thing that I remember also is the importance of really talking about issues like bullying in the nursing workplace, and really coming that from a leader like you is just really so amazing and enlightening. So I learned a lot from it. So what about what about the rest of the participants? I am sure, and even some of your former graduates from you when you were still working as a dean are sending me a message that you were their dean.
Yeah, I'm very happy if I'm sure that lots of those students are presenting, and you know, I'm sure they're big bosses now. Maybe joining working for one of them, inshallah. I'm still very young, huh? Thank you.
Also,
those students, honestly, yeah, listening to you. Go ahead.
That presentation is actually hopefully will inspire the leaders who are here, because we have some master students here who are also deputy directors and directors in their hospital institutions. I really hope that they learned a lot from it, because it is what more can I say? as I said. So
Well, Banjo, the key word that I want to leave everybody with is we learn together, work together every single day toward the lights, really, and we keep moving. And this is the message that even our CEO and the team and the way that we keep focusing on the purpose is not an easy journey, and we have to come and help each other getting there, and we cannot do it alone. I'm speaking on behalf of all the hard worker, all the champions, all Mecca dedication staff. This is their work and their energies. Without them, this would never happen. And I think the key that we have to build in the clinical practice, we have really to bring it to more healthy, to work together, trust each other, get busy at work, not busy at talk. Walk our dream, walk our talk. You know, there's so much that we can do that makes us, all of us, happy and fulfilled, as long as we know that every step is going to have an impact. And that's the only message I would leave all my colleagues, my friends, and I'm happy to share with you anything, if you, any advices, any learned lessons, even privately, and we're here to work together, inshallah, toward our big purposes, bi'idhnillah, for nursing. Thank you so much.
Honestly, doctor, that is impact, and that is really inspiring. Even me, I was moved by your story, because even in our chat group, I told my students, please listen very carefully about every words that Dr. Ilham is saying, because I can still remember having this conversation with you. And then when we talked, and really I felt passion. So, and that actually emanates from the way you talk and the way you are telling your story to us. It is really such an inspiring presentation. And I really hope that that this model or this way of doing things will serve to become the mod. I mean, something that will model the way for everybody within Saudi Arabia. And I'm really so inspired and moved by the presentation. Thank you so much, Dr. Ilham. All right, so I guess we will have to move now to our next speaker. Our next speaker is a Saudi nurse educator, a researcher, and a nursing consultant. She studied her Bachelor of Science in Nursing at King Saud University, her Master of Science in Nursing, also in the same university, and her PhD in Nursing in the University of Saskatchewan in Canada. She's an extensive leader and have administrative experiences in scientific committees, and received numerous awards as well in her field of specialty, and had published researches in different areas such as EBP, leadership, compassion, and many other areas. Her interest includes nursing education research, qualitative research, and rigorous research. She is currently the Assistant Chair of the Medical Surgical Nursing Department in the College of Nursing at King Saud University. So let me call Dr. Munira Mahmoud Al-Blushi, and to discuss to us the past and the future of nursing research in Saudi Arabia. Dr. Munira.
Good evening, everyone. It's my pleasure and honor to be here with my colleagues. And, yes. Good evening, everyone. Do you hear me?
Yes, doctor, clear.
Okay. It's my honor to be here, honestly, and to be with my colleagues and other leaders in Saudi Arabia, especially Dr. Ilham. When she is there, I feel safe always, because she's one of the role models for all nurses in Saudi Arabia. Today, I'll be presenting about the past and future research or future of nursing research in Saudi Arabia. In this presentation, I'll discuss the focus of past nursing research, outline the research methodology that can be used in nursing research, discuss the future direction of nursing research, and some recommendations.
Excuse me, Dr. Munira, could you share from your laptop?
I do share it.
Yes, you could. Okay.
I do. Do you see it?
Not yet, though, not yet seen.
Okay, I'll try to share it again.
All right, great.
Yes, okay, no.
We see it now, Doctor.
Okay. The past 3 decades have witnessed a remarkable growth in nursing science development and a dramatic increase in number of published research. In Saudi Arabia and other countries, nurses work to address important issues related to the nursing image, history of nursing profession, and nursing education. However, we need more research or more research projects to cover areas such as self-management, genetics, geriatric, health promotion across the lifespan, technology, mental health challenges facing the advancement of nursing profession, and education. When I was preparing for this presentation, I searched some of the databases, and because of the short time that I had during this preparation, I used PubMed to prepare for this presentation, and I found this graph, and I really like it because this graph shows how the research in Saudi Arabia was progressing slowly from the 70s to almost 2002, and there wasn't like many research done or many research published during that time. However, when I did this presentation, I wasn't looking for research like written in Arabic or any thesis or dissertation. So when in the early 70s and 80s, most of the research were published by non-Saudis, which is expected because during that time, most of the nurses who are working in the health system were not Saudis. And we appreciate the effort that they did, or the publications that they wrote to address nursing profession during that time. During that time, like the first program, like graduate program, was started in 1987 in King Saud University. So these research or these titles were just the experience and the views of nurses, mainly Western nurses who were working in Saudi Arabia during that time. After, in the 90s and until 2021, there was, more research published, and but it was concerned about the image of nursing, challenges that face the profession, overview of nursing profession development, and status of nursing profession in Saudi Arabia. This was the first, I think, the first study that published about nursing in Saudi Arabia, or what I found was done by Jackson and Rebecca. They developed a survey to assess or determine the attitude and general knowledge of Saudi nationals toward nursing. And they found that, yes, nurses are very important in health system. However, nurses were perceived as an extension of the physician with little or no role in disease detection and prevention. And they also reported that low image and status of nursing and the social values during that time were major challenges or inhibiting Saudis from getting to nursing schools. Another study was done by Dr. Ilham, and it was again about again investigating the perception of university students and their parents about the nursing profession in Saudi Arabia, and similar findings were reported. Sambari wrote one paper and one chapter about the status of nursing profession in Saudi Arabia and the role of nurses, and she mainly focused on the female nurses' experience because the challenges during that time, the challenges that are facing the female nurses regarding working outside home for longer hours in a mixed gender environment. And she reported the challenges that female nurses are facing in that time. Many research published from 1998 to 2006, and these studies honestly were cited many times because they were discussing the culture, like the cultural challenges facing international nurses, the development of nursing in Saudi Arabia, the knowledge and attitude toward nursing profession. But I chose some of the research that were, very, I think, or I believe that they are very important for the body of body of knowledge in or the research in Saudi Arabia. The first one was done by Aisha Al-Dawsari, and she wrote a paper or a review paper discussing the healthcare and nursing development in Saudi Arabia. And she proposed or reported that there is a need to increase the Saudi nurses because they can provide, they can understand the patients and provide health education, and they are able to understand the cultural and language background for Saudi patients. Another study was, or review was done by Dr. Al-Maliki from Taif University. He wrote about the nursing profession in Saudi Arabia, history, development, workforce, professional practice, and he suggested that to use the media to engage more nurses or to improve the nursing image in Saudi Arabia. And he recommended to change the length of nursing programs from 5 years to 3 years, which is not compatible with the international programs, because most programs are 3 years. 3 years in many developed countries, and provide more incentives for nursing students during their internships, during their internship and during their nursing programs. Dr. Al-Ghamdi wrote a paper about the transformation in nursing profession, as Dr. Ilham presented just a few minutes ago, and he reported that in order to get magnet accreditation or recognition, we need to support nurses and encourage nurses and collaborate with, like as a team members, or collaborate to provide the best or to enhance and develop nursing profession, as Dr. Ilham discussed or presented previously. Dr. Dosri wrote a paper that discussing the nursing profession and what we need to do as a nurses to align the nursing profession and the strategic plan with nursing with the Saudi 2030 vision. And she reported that we do have, or we face many challenges. One of them is nursing shortage, underdeveloped nursing education and curriculum, unclear scope of practice. However, the Vision 2030 included many, programs that related to nursing profession, and we hope that more changes will be seen in future. Dr. Abu Shaiga wrote a nice review about the different strategies to address the nursing shortage in Saudi Arabia, and he reported that to attract more students, we have to use social media and media to improve the workplace environment, to address workplace issues such as teamwork, adequate staffing level, and cultural and address the cultural different cultural backgrounds, and to provide more opportunities for Saudi nationals to study, to get their graduate program or to get in graduate program, and to have more support, as Dr. Ilham discussed in her presentation. We do have many studies done or published in 450 almost papers were found, but most of the papers were mainly focused on nursing students, nursing education, nursing profession, clinical education, nurses satisfaction, chronic disease, and the main focus was diabetes and cardiac disease. But their efforts are, these efforts are scattered. They are not under certain themes or scope. And I think this is because most of the papers are published from the academia, where we need, promotion, and we need points for promotion, and we need to change the topic that we did in the PhD and other things that involved in academia. But what I really like to share is two research areas. One is violence or domestic violence, and the leader or the researcher who is working on that area is Dr. Al-Halal from King Saud University, and disaster nursing, which is done in Taif University under Dr. Thubaiti. I'm mentioning the names for nurses who are interested to do research, to be able to approach them and, for research collaboration. Dr. Thubaiti is doing, nice work in disaster nursing and disaster management. When it comes to ways to answer nursing research questions, we do have different ways. We start with literature review, and we can do systematic review, integrative review, scoping review. We can do qualitative research, which is more applicable in nursing practice, because in qualitative research, we assess the subjective and lived experiences of the participants, and we can hear their real experiences. And when it comes to quantitative research, we can do descriptive, correlational, experimental, quasi-experimental research, and we can combine qualitative and quantitative, and comes with mixed methods research. Here I share some of the resources that can be used by nurses when they are interested to conduct any systematic review project. The book is, a nice guide for anyone, for a novice nurses or researcher who are interested to conduct a systematic review. Some of the resources that can be used when we do qualitative research, and there are many resources, there are many methodologies, and for each methodology there are different steps to follow, and but this is one of the good resources that can be used if you are interested to conduct qualitative research. When it comes to quantitative research, you can use this book as a guide for you in the whole research process, like from the research questions to the to report the proposal, and for any novice nurses, it's easy to read and it's not complicated, and it can guide you through the process. When it comes to database, this SDL or Saudi Digital Library is a great resources or a great database. You can use it, navigate there, find Arabic and English resources or articles, and you can find even literature in Arabic, or studies were done in Arabic and English, as I said. Thesis and dissertation, however, what we are missing there is the thesis were done in Saudi universities because they are not indexed in the library. And I think, one of the recommendation I feel that it's very important for advancement of nursing profession is having these theses to be indexed in the Saudi Digital Library and have it accessible for nurses at national level. I like to share this Twitter account because it shares all the published nursing research, and it's updated like regularly. You can find recent research that are published. Whenever you are ready to publish your paper, please don't go to predatory journal. Don't throw your effort there. Go to this website and search for a good journal that is not a predatory journal, because if you publish in predatory journal, it is not included in when they comes to statistics of research in Saudi Arabia, and it can't be used as a reference when you want to publish your paper. So avoid publishing in predatory journals, and make sure that if you want to publish or you are looking to publish, try to look at these websites. When it comes to building or preparing research priority, research or areas for research priorities in Saudi Arabia, it's very simple process, and I think, or I would recommend the Saudi Nurses Association to take the lead and to start by meeting with the stakeholders, nurse educators, researchers, leaders from clinical practice, nurses, and to develop areas for research. Because as I said previously, the efforts are scattered. We don't have research priorities at national level. So we need just to meet together and build our research priority at national level. Future directions or recommendations. I think we need to collaborate with other disciplines, medicine, physiotherapy, pharmacy, and create nursing research centers. We do have research centers in many institutions, but we don't have nursing research centers. We have to recognize the importance of mentoring future nurse researchers. Nurses don't have time to do research. They are not prepared to do research. And some of them, they are they didn't even take research courses during their undergraduate programs. So mentoring program for research, I think it's important and it needs to be implemented. Create national research groups and collaborate between health sectors and universities to conduct research projects at national level. As I said previously, develop a national research priority. We have to change the promotion process in academia, and adding more points to collaborative research projects will enhance the research collaboration among researchers in Saudi Arabia. Develop a database for all nurse researchers in Saudi Arabia, and that includes their research areas and contact information. Whenever a nurse is interested to do a research, they can go to them or contact them for a research project. COVID-19 was a great example and for collaboration. We found many research projects that was done as national level, regional level, and international level. We need to see more collaboration in other areas, especially nursing practice, patient experience, different chronic disease, community health nursing. Like, these areas are not well researched or not investigated yet. As I said, we need to provide training for nurses. We need to provide them with fund, with resources, with time or free time to conduct research. It's nice to have a National Research Day. And before the pandemic, the Ministry of Health held برنامج باحث or researcher program. And it was nice because nurses were working with one of the professors in the universities, and they have to publish a paper at the end. So I think promoting research days and these programs will, add more research and more literature to the body of knowledge in Saudi Arabia. We need to provide nurses with awards and build more graduate programs. When I say graduate research program, I mean program that required students to do research, because it's nice to have clinical research, clinical graduate programs, but we need research, graduate research programs to, as I said, to build the body of knowledge in Saudi Arabia. Thanks all.
Thank you, Dr. Munira, for the nice presentation. And you highlighted an important point related to the vision of Saudi Arabia 2030, that we need to develop the research. And I guess now there are many Saudi research related to, like in the qualitative research, a lot of quantitative research, also and mixed method research in high impact journals in all databases. And as Dr. Ola here, she said that, as you mentioned, Doctor, you mentioned that we need a collaborative research with our students. We had some research, not few, but some research with our students. Also, we need really to improve and to make more collaboration with the hospitals, like collaborative projects, which is very important. Thank you so much for your highlight presentation, Doctor. And if there is any question, we can, yes, it's a worthy presentation. Yes. Evidence-based practice research. Yes, yes. Thank you so much, Doctor. Thank you.
Thank you so much for raising those very important points. But one of the things that I really liked from the presentation, when Dr. Munira said SMA can be one of those driving forces to take the lead. So that's actually one of the most important element that I heard, because there has to be a leader, or there has to be someone that will become the driving force for those changes to happen. And I think in any sector or any sectors in a nation, for example, growth starts when there is research, or a part of that growth is actually research. And one of the things that I think you mentioned it a while ago also is the importance of collaboration or collaborative kind of research, and also that kind of collaboration that can be done with other healthcare providers. Good thing, I mean, contemporary nursing education already is starting to integrate interprofessional education to the curriculum, which is actually, I think, is great. Another thing is the importance of mentoring nurse researchers. So I think in any kind of curriculum, or it depends on the type of curriculum, on how the curriculum was structured. Like, I will give an example. I know a curriculum wherein the students are being prepared to plan their career. And a part of planning in terms of their career trajectory is actually targeting for a student to have a research at least, even before they graduate the program. So there's so many important highlights and elements in this presentation. And we really appreciate that Dr. Munira for giving excellent resources for our students. And I think most of the students already captured some of those references and bits and pieces that they can collectively utilize, particularly in their search for their dreams to become a nurse researcher. So we really appreciate that presentation, Dr. Munira. So now I think, Dr. Nermin, we're about to move to our next presentation.
Yes. Yes, Doctor.
Yes.
Our next speaker will be Dr. Munir Al-Mutayri.
Yes.
Dr. Munir. Yes.
All right. Dr. Munir Mutayri is, let me just, of course, give an introduction to our next speaker. Dr. Munir Mutayri is an advanced practice nurse. He studied his PhD from Carolina University in 2020, and his master's degree from Mamie University, that was around 2015, and his Bachelor of Science in Nursing, of course, from King Saud University way back 2010. He has been working as an assistant researcher for 2 years. That was from 2017 to 2020. At the same university where he graduated his PhD, and that was in the United States. And he has been teaching undergraduate and postgraduate programs, and currently working as an assistant professor in nursing education and administration in the College of Nursing at King Saud University. And he had an experience of being an internal editor and chairman of the curriculum committee, new program committee. And in addition to his publications, he is interested in nursing education, working environments, patient safety, and building advanced practices. What is interesting with Dr. Munir is probably most of the nurses here in Saudi Arabia doesn't know that there are so many advanced practice nurses already in this country. So let me welcome Dr. Munir Mutayri as our next speaker to talk about advanced practice nursing roles in Saudi Arabia, current and future directions.
Thank you, Dr. Binju, for the introduction. Do you guys see my slides and hear me?
Yes, Doctor.
Okay. All right. So thank you very much, Dr. Binju, for the introduction. And I also would like to extend my thanks to the King Faisal University College of Applied Medical Sciences Department of Nursing, specifically to the Dean, Dr. Sultan, Dr. Binju, and the rest of the faculty and the staff members for organizing this important event. So my speech today will be about the advanced practice nursing roles in Saudi Arabia, current and future directions. So we will shed light on several important points in terms of what's the advanced practice roles, and where we are at this moment with the advanced practice roles in Saudi Arabia, and where we are heading in the few couple years, inshallah. First of all, since we are talking about the advanced practice, let me first congratulate a couple of my colleagues who got their classification today from the Saudi Commission for Health Specialties as senior specialist in the advanced practice nursing, Ms. Shamsa, Ms. Nasra, and many of the first cohort from Princess Noura bin Abdurrahman University program, advanced practice nursing program. So congratulations. And since we are talking and extending congratulations to my colleagues, the question is, what is the advanced practice nursing? First of all, let's define it. So advanced practice nursing is actually having a master degree or above in one of the APRN, the advanced practice registered nurse areas of expertise. They must be licensed in their state and must pass a national certification exam in order to practice in one of the following areas. So mostly these areas are the certified nurse midwives, certified registered nurse anesthetist, certified nurse specialist, and certified nurse practitioner. So what we see in Saudi Arabia, mostly the certified nurse midwives are being a separate track right now, and we are seeing a couple of the universities having a bachelor degree in midwifery. So the way we see midwifery in Saudi Arabia is, at least the way I see it this moment, is a separate track starting from the initial preparation at the educational level, I mean at the university level. Then the second role is the certified registered nurse anesthetist. I was looking for Saudi who got this or was classified as a CRNA. And a couple of days ago, I heard about one Saudi. She got her master degree as a CRNA, Ms. Dua Al-Awadi. So congratulations. Most of the Saudis were either certified nurse specialist or certified nurse practitioner. So specifically, I will focus on these two roles, the CNS, the NP. When it comes to the educational preparation, they do have advanced degree, either master degree as an advanced practice nurses, or postmaster certificate as an advanced practice nurses, or doctoral degree, which means the Doctor of Nursing Practice, the DNB degree. From an approved institution, they must pass a national certification exam in one of the specific areas. Most of these programs are or takes 18 to 36 months to complete, depends really on the status of the students, whether they prefer the full or part-time status. So that's when it comes to the educational preparation, and then the certified or the certification exam for the specific role. When it comes to the CNS, the MB, there's a lot of confusion in terms of what are the specific task roles for the MB and that distinguish the MB from the CNS. If you look at a couple of the states in the United States, many of them have really similar roles when it comes to the clinical roles. However, the CNS might have additional preparation when it comes to the organization, leadership, research, education. And in contrast, the MB would have an extended clinical preparation with an extended class registration for the prescriptions, for the diagnosing, etc. But really, this is depend on the state where they practice. So that's in the United States. When they are prepared at the master or postmaster certificate or the DMB degree, they would start first with the core courses. So they start with advanced pathophysiology, advanced pharmacology, advanced physical assessment, And then starting from the second semester, they would take courses that's specific to the specific role, either MB, or CNS, or midwives, or CRNA. And then plus to that, they would be also focusing on the specific population. So some of them will be very specific to the adult gero. Some of them will be very specific to the pediatrics. Some of them will be specific or specialized in neonatal, and some of them will be across all lifespan, like the family nurse practitioner. And along with that, they also will be the training will be tailored to the setting, either acute care or primary care. So this is the pyramid of the advanced practice preparation. And once they graduate, have their diploma from the university, excited about it, and then what's the next step? So mostly what comes after the educational preparation at the university level is the specialty or the subspecialty preparation, where they go to the fellowship programs to be like oncology nurse practitioner or palliative care nurse practitioner or oncology, CNS, etc. So this is how the advanced practice nurses get prepared, depends on the North America model. And of course, there are several models across the world, like the Australian model, the European model, and etc. Some of the responsibilities, they get additional privilege to diagnose, medical diagnose, and treat patients. Part of the treatment is the pharmacological treatment, the non-pharmacological treatment. They can conduct in-depth physical examination. They can prescribe medications, order labs, order X-rays, CT scans, MRIs, etc. And they can also collaborate, consult with other provider. And on the other hand, they also, outside of the clinical side, they can practice as an academician, or also they can practice or participate in research. So specifically, they are working in clinical areas, and then also they can work in academic area, they can work in research and leadership roles when it comes to the different aspects of the functioning. So this is specifically the APRN. So the question is it really a cost-effective approach in healthcare systems? And speaking of the cost effectiveness, let's say that these roles were first implemented back in the 90s, but the most or the role that got the most attention was the nurse practitioner, because of the type of the population that this role would deal with, would go out to provide care for patients in primary care. So that's why the nurse practitioner got most or more attention compared to the rest of the advanced practice roles. Not saying that they weren't highlighted in the literature, but all of these roles were very important and effective providing care. But I think the one that got the focus on was the MB, specifically the primary care MP, back in, I believe in 1962 in Colorado State, when they first started the nurse or established the nurse practitioner role. So the question is, is it really a cost-effective approach? Let's talk about the MB, where we have a lot of research about. So when it comes to the hourly cost of the MP, they cost 1/3 to 1/2 compared to the cost of the physician. This is when it comes to the compensation from the insurance companies, payment like salaries or etc. It's really costing 1/3 to 1/2 of the cost of the physician. And I will shed light on why do I make this comparison. This is coming in research, and most people would talk about it like nurse practitioner would be a replacement of physician. This is not true at all. This is like increasing access to healthcare, working collaboratively with other healthcare providers. And that's why we are introducing the nurse practitioner role and the other advanced practice nursing roles. So when it comes to the preparation, or sorry, the hourly cost, this is really a very cost-effective approach. When it comes to the saving, applying the MP roles and then looking at the saving from the immediate, from patient care, the saving could be around $16 billion over time. I think the research that looked at this specifically was for a period from the 90s until 2008. So there is a saving, cost saving from implementing the MP role, and the saving was in form of length of stay, shorter length of stay, fewer emergency visits, and fewer number of hospitalizations because of increasing access to healthcare through the advanced practice role, specifically the MB role. And then also another study looked specifically at the nurse-managed centers, which is another form of the nurse-led clinics. And also the study showed the significant saving, less cost intervention, fewer emergency visits and hospitalization. When it comes to the benefit to cost ratio, for every dollar spent investing in the expanding the role or enacting the role of nurse practitioner, there is a saving of $2 to $8.7. So it's really a cost-effective approach when it comes to the saving across different settings. The other outcomes is the cost of preparing MBs at the educational preparation. So looking at this statistic from the American Association of Colleges of Nursing, the cost or the MP preparation cost is actually about 20 to 25% less than the cost of preparing physicians, and the total tuition cost of the MP preparation was less than 1 year tuition for medical schools, actually, either MD or Doctor of Osteopathy. So it's really another way of showing the cost effectiveness of this role, plus the impact on healthcare outcomes. If you want to look at more studies that shed light on the effectiveness of the MP roles, this is a position paper from the American Association of Nurse Practitioners, where they have a lot of research that highlight the impact of the MP roles on several outcomes. So I think the question is, why do we need the APN roles, either the MP or the CNS in Saudi Arabia? Do we really have an evidence showing that showing the effectiveness of the APN roles in Saudi Arabia? I think the surprising answer here is yes. There's actually efforts from one of these institutions in Riyadh that has started this role back in 2000, I believe, 8 or 7 officially, and then they try to publish, or they actually published a couple of papers looking at the impact of the nurse practitioner or the nurse-led clinics on the patient outcomes. So this is a study by Dr. Bidair back in 2015, where they looked at the nurse-led heart failure program and the impact on all-cause mortality rate. And actually, the or having a heart failure program that was led by nurse practitioner independently associated with reduction in all-cause mortality rate. So this is really a significant outcome, an important outcome from a local hospital in Saudi Arabia. Another member of the team, Dr. Auda, also looked at specifically at the heart failure outcomes, and they found that those who follow up with nurses in their clinic actually have lower readmission rate, which is really a significant finding in this study. Also, another study by Dr. Badir, they looked at different outcomes, either patient-related outcome, institution-related outcomes, or healthcare-related outcomes, and they highlighted a model of care that they have been implemented in their institution, and it's actually showed a lot of outcomes that really showing an evidence of how significant the MP role on patient outcomes, institution-related outcomes, and healthcare-related outcomes. There is also another study by Dr. Fatouh at the same institution looking at the chronic disease outcomes, the hemoglobin A1C, the controlling of diabetes in general, and actually those who follow up with nurses in their clinic who are actually prepared as a nurse practitioner in their clinic, having really optimal outcomes and really good glycemic control. And also with the self-management. So this is really an important outcome, controlling for diabetes with nurse-led clinics. Another also study from the same team published in 2011, they looked specifically at the cardiovascular risk factor, either first the diabetes mellitus control, blood pressure control, lipid profile. All of these showed really significant outcomes when it comes to the following up with nurses, nurse practitioners. They call them nurse specialists in their institution, but the preparation is actually preparation for nurse practitioners. And the improvement in outcomes across these measures were showing significant improvement when they follow with the nurse practitioner. So I guess what I'm trying to say here is that following up with nurse practitioners in their institution actually showed an equivalent quality of care provided by physicians in their institution, if not better. And this is also another study looked at the adherence, the optimal adherence to treatment regimens, specific medications, the AC inhibitors, etc., compared to global or international benchmarks. So actually following up with the nurses and their clinic showed higher significant adherence to medication regimens. So these are several research outcomes from local hospital. So really, again, the question, why do we need it? I think, first of all, the outcomes, but the patient outcomes, but also the other thing why we need it is actually having clinical pathways in nursing. Let's look at what's going on in Saudi Arabia right now. Nurses get prepared as BS or having the degree as having the BSN degree. They go to they get the classification as nurse specialist. They go to practice as a staff nurse one, depending on the institution, and then maybe 2 years, 3 years later, 5 years later, they want to grow in their area. And then what's the option, or what are the options here? Mostly are the master degrees. So they get the master and then they come back to where they work. But when it comes to the scope practice, it actually doesn't change at all. Is it really a problem with the master programs locally, or actually with the institutions that doesn't have scope practice? I think it's a combination of both. So looking at the academic programs in Saudi Arabia, mostly until maybe 2016, all of these programs were does not have clinical component that prepare nurses with advanced roles. So if they get the master degree and they go back to the clinical area, they actually don't have enough preparation to practice or doing an advanced procedures, advanced skills that they expected to do. So actually the scope practice doesn't change. And then the other thing, looking at the consultant nurse, the way to be a consultant as a nurse, classified as consultant, is to do the PhD degree, which is really doesn't have anything to do with the clinical practice. It's actually a research degree. We don't have a clinical pathway I guess what I'm trying to say at this moment, clinical pathway all the way to be a nurse consultant, taking into consideration the advanced skills that these nurses need to be prepared to, or having the skills that they need to practice at this level of the senior specialist or consultant. That's why if we look at the average age of nurses in the clinical area, it's really shorter number of years compared to the other countries that have clinical pathways to be advanced practice nurses or other classifications. And then also what's going on along with that is the turnover rate or leaving the clinical area in nursing. One thing that I got from the, I think, a conference organized by the Saudi Commission back in 2018 regarding the healthcare workforces, nursing turnover was really high compared to the other medical or health professions. It's actually 20%. So for every graduate, for every annual graduate who join the workforce, you actually losing an equivalent of 20% of those on the other side. So they are leaving the clinical area. The reason why, I think one of the reasons is we don't have a clinical pathways in nursing, so they can stay in the clinical side. But also the other reason why we need the advanced practice roles is actually the healthcare demands. Looking at the ratios of the primary care providers, just an example. The ratio for the primary care providers in Saudi Arabia is about 2.6, I believe, for every 10,000 population. Benchmark this number in the United States is about, I believe, 8.1 for every 10,000 population. Canada is about 12.3, I believe, or 4 per 10,000 population. If you add the advanced practice roles in Canada and the US, so the US will increase from 8.1 to about 13 healthcare providers for 10,000 population. Canada will increase to 15 point something for 2,000 population. But in Saudi Arabia, will stay 2 point something. So we have really a need to increase access in health and primary care settings. And this is going along with the model of care that we have in Saudi Arabia, the new model of care that emphasizes the primary care services. So this is one of the reasons, and this is the benchmark that I just mentioned. So if we have advanced practice roles, we will increase the access, and then maybe the numbers would go high. And I'm sure it would go high compared to the, or relying on the benchmark from other countries. So what's going on in Saudi Arabia? I think what's going on is the academic institutions having lead here, implementing these roles or enacting these roles, starting from Princess Noura bint Abdulaziz University back, I believe, in 2016. They have the Advanced Nurse Practitioner Program. And just this year, we have the Saudi Electronic University started the Primary Care Nurse Practitioner Master Program. And that doesn't mean these are the only two programs, but I think there are a couple ongoing initiatives across several universities to establish graduate level programs for the advanced practice, either MP or CNS. In the clinical side, we have actually a couple institutions. We have King Faisal Specialist Hospital and Research Center, who have the role, the MB role since I believe the 70s, or late 70s specifically. And then we also have it at the King Abdulaziz Cardiac Center, started from 2000 and officially in 2007 and is still running. And then also we have King Fahad Medical City, I believe starting from a couple of years, a few years, 4 to 5 years, where they are enacting this role at their institutions. So are we gonna see more institutions enabling the advanced practice roles? I think the answer should be, we are hoping yes. And I think if the Ministry of Health take a lead in that, I think we will see more hospitals joining and recruiting the advanced practice nursing. Okay. And part of what's going on is actually the Saudi Commission coming along the way to regulate this role. And they have actually two steps. First, to make sure that the program is actually an accredited program, which is first one. So they have what they call the new qualification study, طلب دراسة مؤهل جديد على ما أظن. So they will run the program, and once they find out that it meets all the requirements, they accredit the program as this is a program that will prepare the nurses for the advanced practice roles. But really, another important step is actually the NP-APN classification, which really they take back and forth. Let's say from 2018. This is my personal experience with the Nursing Professional Council, who really do a great job at regulating the nursing roles and the now the advanced practice role represented in many of their members. So thank you for adding the advanced practice classification officially to the Saudi Commission list of qualifications since mid 2020, specifically late June, early July. This is really a great step for regulating the role in Saudi Arabia. So when it comes to conclusion, I think APN roles will add a lot of significant positive outcomes at different levels, institutional level, individual levels, and I'm sure at the national levels when it comes to the quality of care, the cost of care, and etc. We are seeing several initiatives across educational and healthcare institutions to implement the APN role. And we're hoping that within the few years, we will see more institutions coming along, enacting the role either at the educational institutions or the hospitals across the country. However, I think we need to come to a national scope practice that would be an umbrella for all the efforts across the country to enact this role. So we can really have nurses or advanced practice nurses who can practice at the Eastern province and to the Western region, Saudi Arabia, North, the Southern, and they practice the same across all these hospitals and areas. So this is really a need for a national scope practice. And also there is a need for integrating the educational preparation and the labor market needs through a national APN competencies. This is really important for the educational institution and also for the training institutions, such as the Saudi Commission, if they would start subspecialty training programs, either whether they call it fellowship programs or any other names, but it's really to align the educational preparation along with the training, clinical training, subspecialty training programs, so we can have continuum of preparation, starting from the educational preparation all the way until we have advanced practice nurses at the subspecialty level, oncology CNS, oncology nurse practitioner, cardiac surgery nurse practitioner, etc. I think if we align both together, we will have really clear scope of practice, really clear view of how the advanced practice will add to the country, inshallah. So that's it when it comes to advanced practice. These are a couple of my references, and thank you for listening.
That was a great presentation. I'm sure the master students will learn a lot from that because the master students are talking about this all the time. But Dr. Nermin, you want to say something?
Yes, Doc, I need to ask questions actually, because Dr. Munir, he said that probably there are differences between the nurse practitioner and the advanced nurse practitioner, right? Regarding the competencies. I know that the advanced is more competent, but regarding the salaries, probably it's higher, right? And the number of hours per week, probably it's different, right?
Yes, because the skill
A lot
sets
of
are
differences.
Yes, it's actually a lot of differences. Actually, when it comes to discussion, if you look at discussions on Twitter or other social media platforms, they would say nurses, nurse practitioners. Actually, nursing, both are nursing, and they are advanced practice are nurses prepared with additional educational preparation and training to practice specific advanced roles. I think I will put it this way. So they are actually nurses, and they prepared at specific levels with advanced skills in order to meet certain need at either an institutional level or a national level. When it comes to the payment, really, it's actually, yes, it should be different. And what I see or what I saw in the United States in the couple of years that I practiced over there, actually it's about 60%, 50 to 60% higher compared to the RN income. And that's just an average roughly, but it's really depend on the setting, really depend on the role. The certified nurse anesthetists actually have really higher income for that, and then the nurse practitioner. Say that again, Dr. Bindu.
I said, Doctor, I'm about to interject that also. That's the role of the anesthetist.
Yes, it's actually relatively new, maybe in the country at the master level. And as I mentioned, only one graduate that I know at this moment who was prepared as a certified nurse anesthetist. But mostly it's relatively new. And yes, it should have a different payment scale, should have specific educational competences and specific training competences that they need to acquire across the preparation in order to be able to practice as advanced practice nurses. Yes, so the short answer, yes.
That's so excellent, Doctor. Doctor, I was just talking to a group of nursing education leaders in the US a few weeks ago, because in the US now they released the new essentials, the new AACN essentials, and they were saying that their legs are amputated. So this is actually what they were saying. And I feel like, Doctor, that this is such an area that has a big gap, especially here in Saudi Arabia. I mean, this is the future, or one of the futures of nursing here. I mean, across the globe. And we all know that the gold standard is the United States when it comes to this practice. There are so many opportunities for research. And I think, Doc, also that someone must lead also in terms of developing, just like what Dr. Nermin was saying a while ago, clear competencies for, let's say, the APRN roles, or what will become the APRN model for Saudi nurses. Because if you will come to think of it, like, for example, this university will be offering this kind of program. I mean, what will be the role or the structure or the clear competency of that graduate from a program from, let's say, UK or Ireland or in the US? And how are you going to merge that, or probably collectively unify that, something like that? So, and how will they be able to function in practice? So probably an association for advanced practice nurses or nurse practitioners in Saudi Arabia. How it will unfold? Will it include also nurse anesthetists or nurse midwives? So there are so many questions, I mean, in this kind of topic, and it's really, really very interesting.
Also, Dr. the master students, Dr. Benjamin, I don't know what about the fate of, I don't know, yeah, there is already a pathway for the master after the bachelor, master and PhD. They are not faculty members, but they are nurses and they are studying master or PhD.
Yes,
so what will be the fate? Yes, they will apply for advanced practitioner, because, Doc, as you said, the postgraduate student is not, they don't have the competencies as the practitioners, the advanced practitioners to be advanced. So what will be the fate for those? Yes.
Well, it will definitely unfold. I mean, Saudi Arabia, they will, I mean, their future is, how can I say it, huge. So, Dr. Munir, you want to interject something?
Yes, it's actually one of the really the good criteria that the Saudi, or the really good practices that the Saudi university have is the benchmark. So when we build an academic graduate level program, we benchmark it. So we look at the best practices across the world. to see what are the best competencies for the advanced practice nursing in general, and then what are the best competencies for specific roles, MB, CNS, nurse anesthetist, or etc. in general. And based on that, the programs will be prepared, will be established, built up to have the components that reflect these competencies and graduate attributes. So this is really a great practice that we see across the Saudi universities. I think that would standardize the level of the competencies if we have a national agreed on APN competencies on the other hand. Yes, some universities might lead in terms of having specific competencies for their program, but on the other side, I think if we have a national effort to determine the APN competences, I think that would be really a standard for universities to follow in order to prepare the advanced practice nurses who would meet the labor market needs. That's when it comes to the competences. For those who already have master degree, I think also the other option for them is looking, yes, it's actually having at the best practices across the world. One of the best practices is having postmaster certificate, where they can go back to schools in order to be prepared at advanced practice. These certificates actually, they look at the previous preparation, they take into consideration several factors, and then they try to bridge the gap between the previous preparation, either mostly at the master level, and to take them to the level of the advanced practice. I mean, preparing them with advanced skills, the advanced knowledge that they need to practice it clinically. So this is actually one of the solutions that I proposed earlier in terms of what are we gonna do with the current master programs. They are nice. I think what we have at this moment in Saudi Arabia mostly would be CNS programs. If we increase the dose of clinical or increase the clinical dose in these programs, I think this program will be great CNS programs. But I will leave it to maybe inshallah in the near future we might have something that would regulate the work, the competencies, etc. And yes, hopefully soon we'll see something will put the standard for the educational programs, the competencies, the graduate attributes, etc. Inshallah.
Dr. Munir, thank you. Thank you so much because this topic needs a lot of time.
Well, thank you very much. Thank you. Yeah, thank you for having me. And these are actually my contact info. Please feel free to contact me either on my Twitter or my email. Thank you very much. Thank you for having me.
Yes, to our participants, can you look at this? So honestly speaking, that is such a very interesting topic, and there's so many things to discuss, like certifications. Once you've got to determine the competencies, the next thing now, I mean, how you are going to test those competencies, right? So many things to discuss. But our last speaker for this event is actually one of the nursing education leaders in this country as well, and a quality development consultant from King Abdulaziz University. Dr. Shadia Yusuf, married mother of 2 grown children, and she's actually retired since October 2020, but she came back to work again as a consultant for the Faculty of Nursing in King Abdulaziz University. And she graduated her BSN from King Abdulaziz University, her master's from King Saud University also, and PhD from South Bank University. She is interested in women's health, nursing education, and accreditation. And one of the most notable contributions or notable accomplishments that she had is for her to become the first recipient of Her Majesty Princess Al Johara Award in the year 2000 and received an award of Distinguished Academic Faculty of the Year at King Abdulaziz University. She has participated in a huge number of national and international conferences as a speaker. And I'm actually one of those lucky professionals who got the experience of really meeting her in person in Riyadh. And one of the successful and notable accomplishments in her career is actually to have this accreditation by ACEN from King Abdulaziz University for the bachelor's program and also NCAA during the time that she was the leader of this quality and development unit, particularly in the university. She was a member of the Nursing Scientific Committee at the Saudi Commission for Health Specialties for 3 cycles. And during that period, she developed a 1-year midwifery and pediatric program. She also worked as an external examiner for national and international schools of nursing, and she conducted several workshops related to accreditation and mock site visit. Currently, she is a peer reviewer for ACEN and also a member of the assessment committee at the King Abdulaziz University at the 3 semesters as executive committee, part of the executive committee in another university. So let me introduce to talk about the importance of accreditation of nursing programs, particularly. Let us all welcome Dr. Shadia Yusuf. I hope I pronounce it right.
Yes, you did right. Thank you very much for your introductions. Bismillah ar-Rahman ar-Rahim wa salatu wa salam ala Sayyidina al-Mursaleen wa ala alihi wa sahbihi ajma'in. Assalamu alaikum wa rahmatullahi wa barakatuh. I think I'm sharing. Are you seeing my slides? Do you see my slides?
Yes, Doctor.
Yes, Doc, yes.
Okay. So good evening, ladies and gentlemen. First, I would like to thank nursing program at King Faisal University in inviting me to participate in this important event, where I will share with you some knowledge about accreditation. Okay, and before my presentation, what did I do? Okay. Why
I
it's
think
not moving?
In the beginning, I think it's on at the end. Yes.
But it is not moving.
Doctor, if you can click the first slide. There.
But do you see it clearly?
Yes, Doctor, it's now clear.
Oh, okay. So before that, I would like to present. Before the presentation, I would like to take a few seconds to pray for all the nurses we lost during the COVID period, a pandemic period, in serving the COVID patients and the past 2 years. May Allah grant them peace and paradise and forgive all their sins. But as we know, the COVID is not over. Okay, so blessing to all the nurses who are still working with and fighting with the COVID viruses and carry out the care for the critical patients under the stress of the COVID and its variant. So this is my presentation's objectives, that I will cover some the definition of the accreditation and why the accreditation is important, and how we as a nursing program to accomplish the vision of 2030 through the accreditations, and what are the benefits of accreditation, and appreciate the process of the accreditation, and how we're going to prepare for the national or international accreditations. The appearance of the COVID, okay, COVID-19 in December 2019 in China, an outbreak of the COVID all over the world that became a pandemic and has affected the life and economy and health status of billion peoples across the world. And this pandemic has drastically changed, transformed our life and functions. Many companies, offices, and schools closed because of lockdown and curfew, and we change our daily life functions into online and or distance business. So teaching and learning also are transformed online in many schools and the university. So only healthcare professionals who are still working in the hospital, okay, face-to-face, 24 hours, day and night, especially nurses who are working, dealing with the patient and under the stressful of the the COVID and the limited resources and equipment and staffing in many hospitals. So the nurses are on the front line and are responsible for providing the holistic care for the COVID patients and non-COVID patients, whether physically and psychologically. So the nurses are the most important people that we require. As we know, that the 60% of the healthcare provider in the healthcare system in Saudi Arabia, there are nurses. So the COVID-19 era has shown and proved to the world that the nurses are important during the pandemic period and has a significant role in fighting the COVID. So we come to the transformation of the Vision 2030 of Saudi Arabia. Looking at this transformation, because there are the Saudi is undergoing the major transformation through this Vision 2030. So the Visions has launched a roadmap for the strategic plan for the Kingdom of Saudi Arabia. So looking at the vision, there are three pillars. Okay, these three pillars are the main pillars for the Vision 2030, as mentioned before, the vibrant society, and thriving economy, and ambitious nation. So our role as a nursing program or the College of Nursing, that we could help to achieve or to participate in achieving this vision of 2030. Because there are one on the health sector, there's one objective that improving quality and efficiency of health services. This is one of the objectives. So we as a nursing program or nursing college, we could prepare the nursing quality nursing outcomes in order to provide quality care in the health sectors. So this is one. And under the human capability development program, there are three objectives. Number 10, number 15, number 11. Number 15 is improving readiness of youth to the labor market. Okay. And the number 11 objective is improving ranking of the education institution. And number 10 is improving fundamental learning outcomes. So these three objectives, we as a nursing program or nursing college, we could, to improve the quality of our education to our students and help to get the colleges to get all the higher ranking through better quality teaching. And in addition, and prepare our graduates to the labor market, prepare them according to the need of the community. So when we have a good quality of the program, so then the market labor will have received all this our graduate with high quality and with competences, then they can serve and provide better health and safe patient care. So looking at this one, so that means accreditation will help us. Okay, it's a process, will help us to guide all the nursing program in order to improve the quality of teaching and the quality of the curriculum and quality of the method of assessment, all these things. So what is the accreditation? The accreditation is a process, an ongoing process for approval of post-secondary institutions, like after the secondary schools program, and these are provided by the university level, and this accreditation will accredit this program. Okay. At the same time, the accreditation will monitor the quality of the program academically and administratively. So they are looking at the process of the best practices, because the body of these accrediting agent, they have developed the standard and criteria for best practices. In order for the program who's going for accreditation, they have to see these practice, are we practicing this up to the standard or not? So as a process. So at the same time, the accreditation is a process to evaluate and to review to ensure the program are held the same high quality standard. So the overall, the kingdom, all the school of nursing have the same similar standard according to the criteria or standard and the criteria set by the accrediting body. So these the criteria or standards should be met by the program, whether the student are given online or the student is on the campus. So both things that have their similar criteria and similar standards should be fulfilled by the program who is going for accreditation. And at the same time, this accrediting body will ensure the student are receiving the same quality, same specialty in the same field. So not only for nursing, only for engineering and for the laboratory technician, laboratory specialty. So they want to make sure the program is providing the appropriate teaching or education for this specialty. Okay, this is in general. So looking, when we said the program, it is accredited, that means the program has went through very rigorous review and evaluation process. By who? By people, by professional people in the same field of, let's say if we're going to see the nursing, so we have to have people from nursing specialty, an expert, so they are going to review and evaluate the program. So the accreditation will assure the quality of teaching, student achievement and curriculum and academic achievement and other criteria. So if they to achieving the excellency and quality, that is the best practice of that college or that program. So the recognition, when we said the program is accredited, that means the program will receive recognition for the quality and credibility if the school or the program has met all the standard and the criteria of this accreditation. Okay, so accreditation in higher education is a collegial work, a process. It depends of first the college will or the program will assess self-evaluation, and after that the peer people will going to assess the school. So this is two stages: self-evaluation and plus the peer evaluation from outsider. So the purpose in general for the accreditation is to improve the quality, academic quality, and then social accountability. So it will rise up the standard, all the standard over the country in any places. Okay, so do you think that accreditation is worthwhile? Yeah, I believe that accreditation is a worthwhile investment for the school. I know the accreditation will demand a lot of money and a lot of budget in order to start to accreditation and to maintain the accreditation yearly. You have to pay lump sum of money for the accrediting body. So this is worth, because as yesterday we heard and today's lecture presentation, all we are looking at the best quality education. So I think the accreditation will help all the program in order to achieve the same level or same standard. So I think we can, it's worth it for the college to invest in this business of accreditation. Okay, so as we know that accreditation is a voluntary requirement, it's not an obligatory for any program, but because the market demand well-prepared nurses in order to practice to give safe practice or safe care and quality care. So the market demand this quality. So in order that, so we need to have accreditation. Other things, because the market or society demand for quality nursing education. So having accreditation, that means we can ensure the quality nursing education. So therefore, many schools of internationally, they are starting to mandate the accreditation for all the nursing programs in order to have the well-prepared nurses graduate and provide better educational program. So in general, the speaking, while the program is approved, usually in many countries that the approving of the program is through Ministry of Education, such as in Saudi Arabia. So just the Ministry of Education will grant the recognition for the institution and the college to have this program open, and that's it. But because in 2017 or last 10 to 15 years, there are a lot of governmental school and non-governmental school as opened in the Saudi Arabia. So this demanded a body in order to monitor these changes and all this open school, are they in the same quality and same standard? So they start to develop a national commission for academic accreditation. So in order to monitor the quality of these schools, the new schools. But currently in these institutions want to ensure the quality of program, so they require each of the program in the institution to be accredited by NCAA, or they call it ETEC. So now every university starting to start the accreditation process with Saudi Commission of Accreditations. Talking to the ETEC, which is the Quality Education and Training Evaluation Commission, this is established in 2017 in order to evaluate and assess and accredit all the education and training system in the Saudi Arabia. So in addition to promote, to assist and support all the raise of quality of adequacy of the education and training. So they start to develop this. So it is an independent, financially and legally as independent body. And there is the National Center, okay, is established, is under the care of ETEC. So this standard is a continuation of the National Commission Academic Accreditation and Assessment, so the NCAA, as we mentioned before. So these are the same. If you use an NCAA or ETEC, they are on the one umbrella. How many types of education accreditation in Saudi Arabia? We have two types. One is institutional accreditation, and other one is the program accreditation. First of all these institutions or university, they have to develop, they have to gain the accreditation first in order to start the program accreditation. So for the institutional accreditation, we mean that evaluation of the school as a general picture from administration and goal and visions and mission of the university or institution. If it's not a university, it is a college. So we have to, the body will going to review the administration and goals and vision of that college or that university and the financial resources. And it depends on the institution has to conduct self-assessment, submit the self-assessment to the peer, and the peer will review it, and then will, based on the standard and criteria established by the NCAA or ETEC. And the other type is the program accreditation. So in order to evaluate the program, first of all, the institute should be accredited first, okay? And the accreditation of the program inside the institution. If it's a college, you have the college, we have several departments. So each department or each program has to get the individual separate accreditation. If it is a university, you have the College of Nursing, but the College of Nursing has several programs. They have undergraduate program, they have master program. So each program have to get the individual separate accreditation. So for the program accreditation, the commission or the body will going to review the curriculum of the school, of the program, the courses and teaching and method and assessment method and the faculty qualification, if they have enough faculty teaching with the appropriate qualification that they defined by the accrediting body, and all the other resources are available for the to teach the student and evaluate the student. So these are the two main types, program and institution accreditation. So these are the two different separate issues. The first of all, the institute should be accredited, then the programs can start the accreditation. We cannot start the program accreditation before the institution accreditation. looking at accreditation, we have to make sure, because the accreditation in Saudi Arabia is very important in order to maintain all the graduates in the country all over with the same level, same quality of education. Make sure that the students are graduated with the same quality and same education. So this will ensure the quality of patient care. No matter the patient going to which country, going to any city like Jeddah, Riyadh, Dammam, they have the same quality because the quality of students are the same, who are accredited by the program is accredited by the INSEAD or ATEC, and they are safe to ensure the safe and quality nursing care provided for the patients. So looking at this current condition in Saudi Arabia, according to the data that I obtained, there are 39 programs, whether it's a program, it's a department, or it's a college, there are 39. And 26 are governmental programs, and there are 13 non-government, that is private institution for nursing program, okay? Regarding accreditation, so we're talking about 39 program, nursing program, whether it's government or non-government. We have only one college or one nursing program, baccalaureate program, obtained international accreditation, which is King Abdulaziz University, where I am working with when we started the accreditation. The only school we have the international accreditation. And we got the initial accreditation in 2014, and we had renewed the accreditation in 2019, and next visit will be 2027. So we got the 8 years accreditation. And regarding the national accreditation, according to my resources, I found only 6 nursing program got accreditation, but I believe all the accreditation was conditional. None of the program got a complete accreditation. So I think, no, I heard from yesterday presentation that some of the schools are starting to submit the accreditation for national accreditation. According to my knowledge, that the NCAA now, they said the program, if the institution is accredited, now they can start to accredit the program without, and not necessary to have the national accreditation. They could get the permission first from the NCAA, and they will go for international accreditation. So this is one of the positive things that we could implement. If the institution is accredited, then for the program, for the nursing program, we can go for international accreditation. So this is a current situation up to now, but I hope this number will increase maybe after 5-10 years. The numbers of accrediting program will increase, inshallah. So let's go back to see the history of accreditation in nursing. So nursing accreditation started originally, in general, accreditation business started in the United States in 1918. So it's very early stage. And the nursing started in USA in 1920, but the National League of Nursing Education, because we started to accredit the program, it was in 1938. So it's very, very, very old body of accrediting body. So what are the benefits of accreditation? Because it is not obligatory, but we have, because of the demand of the market, so there's all the schools starting to develop to get the accreditation from the accrediting body. And those accredited bodies should be accredited by the government officially, then they will start to get accreditation. So what are the benefits of the accreditation? Actually, the accreditation will benefit the school and at the same time benefit the student. Let's see what are the benefits to the school. It will help to contribute the reputation of the school. When they say the school is accredited, okay, they have developed a good reputation, and they will gain the high status of benefit that they are good educator for education provider for the nursing program. So this will translate that into the more enrollment of the student to the program. So this is one of the general picture for the program when it is accredited, the benefit the school. So more student will enroll to accredited. If you look at the website searching of admission for school, first of the sign they said, go look at whether this program is accredited. If the program is accredited, go and start to register in this program. If it is not registered, not accredited, don't register in this program. So because this is the benefit of the student, because any program is accredited will help the student when they want to transfer from one program to another program. The school will accept the transfer credit through if the program is accredited. This is what happened in the United States, not in Saudi Arabia, because Saudi Arabia was still in an infancy stage. We don't have accreditation, much program is accredited. So for the internet, in the United States, I'm looking at literature in the United States that any program, any school that will not accept the student transfer from non-accrediting program. So the student have to repeat many subjects in order to start in that different school. Or if the student want to go for further study like master and PhD, if she's finished her program is non-accredited, they will ask her to or him to repeat a lot of courses in order to get accepted in the master program. And other things, the accreditation is any graduate from the program, which is accredited program, the student will immediately be hired by any hospital. Like in the United States, they have several hospitals. They are demand the student graduate from accredited program. They will accept them. Who are not accredited, they will go maybe to the less quality hospitals. So this is one of the major things. The student will see whether they are accredited graduate from the accredited program. They will be accepted immediately after graduation. So finally, the accreditation process will improve the quality of nursing education. Now, let's go, since we are talking about accreditation for nursing, let's see what are the international nursing accrediting body. ACN, this is the American Accreditation Commission for Education of Nursing, and there's two bodies only in the United States, and the CCN, Nursing Commission, Commission of Collegial Nursing Education, is established in 1998, and the academic accreditation for NCAA, ACN was established in 1996. Okay, when it was before belonged to formally is known as National League Nursing Academic Commissions. For the Britain or UK, there is a general program accreditation. It's not specific for nursing. It was established in 1984. And Canada, they have the CASN is established in 1987. So the most senior or have the more experience is ACN. It's formerly Nursing League of Education, then they became Nursing League of Accreditation Commission, and then they in 2013 they changed the name to ACN. So this is the only program. This body is only doing international accreditation, because in nursing college in King Abdulaziz University, we start to communicate with when they were named as National League of Accreditation. We start to communicate with them in 2000, I think 2010, and they said they don't do international accreditation. But in 2011, at the end of 2011, we communicate with them again. They said they started to develop, to accept conducting accreditation for international program. They already started, I think, with some British colony. They started accrediting the program. So we started with them in 2012 and starting to develop all the requirement and everything. So the rest of the international accrediting body, they don't provide international accreditation, only for the local issues. So in order to get accreditation, there are some tips to help everyone to go through accreditation. Okay, one of it is we need to stay organized. The most important things we have to organize, because this is what I personally experienced during our accreditation when we started in 2012 or 2011, because at that time we don't have any data, no resources. I mean, we have resources, but there is no data and no tools, no assessment, no nothing, almost nothing. We have to create, to generate all the templates, all the forms, all evaluation form. We have to get the feedback from the graduate. We have developed a tool to assess the program and to assess the student feedback and faculty feedback and develop all this. So the first step, we have to develop our own template forms, assessment, and gather how to gather the data. And keep all the documents in one place in order to save time and effort. If you develop a good system in order to keep all the documentation is very important, because before that we were not documenting. Yes, we are having good program and our graduates very compatible to the market, and they are immediately hired by the different hospitals, but we don't have good documentation. So most important thing we have to start, if any school or any program want to start an accreditation, so they have to start to document all the things, every single bit of the practices we are conducting in the program. We have documentation with a date, though this will save our time and effort. And other things, we adopt a collaborative approach. So we need all the team in the college, whether administrator, secretary, from the head to the bottom, all the team of the school, they have to participate in the accreditation process. Not the individual person job. It's not one person job to collect all the data and to write everything. No, it is a group work and collaborative work. And we have to set regular agenda for team meeting, because in frequent meeting, we remind the people to prepare the things and document everything. So in order to monitor the things. The fifth number, the focus on the quality improvement always, because when accreditation is for improvement, it's not one, it's just an one process and done and that's it. No, the purpose of accreditation is for improvement. So we have to improve the quality of teaching, to improve the quality of faculty. So these are the things we have to develop through before we start the accreditation. So, and other things we have to develop, define good indicators, and we have to review this indicator by defining what is our target, and we assess this year and the next year we're going to assess the target. Are we achieving this target or not? And why we are not achieving our target? What are the root analysis for this not achieving this KPI or the indicators? So we have to write it down. Documentation is very important. And other things, always consult the expert. Okay, so every program, when they are going to start accreditation, so they have to look at the expert people who had experience regarding accreditation, so they will help them to overcome this problems or this issue of the accreditation process. Is it accreditation a challenge? Yes, it is a challenge. Especially, it's a burden. A lot of faculty, they don't like to hear we are going for accreditation, because accreditation demand a lot of work and demanding a lot of time, and they don't like it. So this is one of the things that, and time consuming. And faculty always said, oh, we hate the accreditation. I remember when I was supervising the accreditation, every time they will see my email, so not again, Shadia is sending another email demanding for extra papers, demanding any extra evidence. So they hate my email. So the most important thing, we have to create a culture, quality in the school. So the started people, orient them by giving their workshop, and every time they send a message reminding them we have accreditation and these are the things. Always make sure that we have a good system develop a good system, this will help the people in order to overcome the frustration and burdenless feeling. So of course, many faculty that don't like accreditation, but when you develop a good system and provide them the guidelines, it is very easy and they start to develop the things. Yes, it is an effort that every time, especially when you develop the first draft of the self-study report. As with I experienced during the first draft, we have to write every single bit and we don't have the forms, and we started to develop the form. So the most important things as a program, when starting the accreditation, do a self-assessment first. Put all the standard, put all the best practices, and check whether we have this in our program or not. Make a list. Okay, we have this list of this practice. Okay, we have, and what kind of evidence we need to provide. If we don't have, go start to develop the evidence and work on this. So this is the improvement quality. Okay, a lot of things, because it's a challenge, accreditation, we have to collect data and documentation and prepare the accreditation, especially the student learning outcomes. We are going to calculate for each course and each course, and we get aggregated and do the analysis. In order to do the analysis, you have to write why this is high, why this is low, and it's not expecting our target value. So we have to write root analysis, okay, for this comparison. And we, at the same time, we can do the benchmarking with other institutions. Why this institution have higher KPI and when we don't have it? So let's see what are the causes for this low KPI. So we can provide and develop new evidence and improve and do a lot of action plan. So the most important thing, you have to develop a good system for defining what are your assessment, what are the documents you require in order to do and keep all this document in the same place in order to easy access. And other things, we have to be open, whether you are a leader or manager or the faculty, they have to have the same level of understanding to all the requirement of the accreditation. There are some problems happen during accreditation because accreditation demand a lot of evidence. And where we are going to get this evidence is from documentation. So each of the faculty members, this is from the study, they found that they are spending 30 to 40% of their time to update the document. And at the end of each semester, we're going to update the student learning outcome. At the end of academic year, we're going to see the cumulative learning outcomes and all the key performance indicators. Are we getting all the marks? And the student are evaluating the program, and the faculty are evaluating the program, stakeholders evaluation to our graduate. All this data we have to calculate. But if you have developed a good system and assign the person, appropriate person to that responsibility, I think we'll be safe and will not have any problems. So gathering data, sometimes we're prone to have some mistakes, but it will take time in order to correct these problems and repair the problems. And this is the stages of, according to our experience in ACN accreditation, it is international accreditation. They have 5 stages almost. The first one, they have to see the college have the candidates for accreditation. Before you go for accreditation, they have to look at the program, whether this program could go for accreditation. So they require a lot of documents. And then after we're sending all the documents, they will come for consultative visit. Okay, site visits, they will send 2 persons from the ACN. They will ask and assess actually to the place and see whether this program has all the requirement and the standard. And then we'll start, okay, now you are approved to have the candidacy, then you can start to develop your self-study report. This is within 2 years after the consultative visit. You have to submit the self-study report. If you did not submit your self-study report at that time, the candidacies will waive, and then you can start another candidacy visit. Okay, so always remember within the 2 years, you have to submit the self-study and define the time to define the site visit, the actual site visit. During the site visit, they will send 3 persons from the accrediting, from different, from academic and clinical specialists to assess the program. So it usually takes 3 days or 4 days during the visit, and they will see all the resources. They will meet the student, they will meet faculty individually, and they will meet the stakeholders, the community, and they will meet staff from the hospital where they're training. We are training our students. They have separate meeting, and then they will see all the committees, see all the reported and evidences, and make sure that, and they will attend the classes as well. They want to see the class, attend one of the classes, and attend the clinical training of the student to see what are the nature of the actual clinical practice and the nature of teaching of the faculty. So these are all been scheduled, and they have to visit, and they will see the lab, especially, and they see the resources, whether you are using the high fidelity or low fidelity, but we have to tell them what kind of things. And after that, they will write a report about the program, and we'll sit together with the faculty and tell us the temporary recommendations. And then after that, we'll submit this report to another committee at ACN. We have, I think, consists of 9 members from different sectors. They will review our self-study report and the report of the team visit, the visiting team report. They will decide, make the final decision whether they will approve or not approve our accreditation. And during that time, they can invite only 1 faculty member to listen to their discussion, okay, from the college. Only just listen, we cannot ask questions, we just can listen, and then they will, after that, they will send the report. For instance, our nursing program, we start the visit during they have the site visit in April, okay, and the report came in I think end of July, and the meeting of the committee we can listen. It was in, I think, in June. So these are the stages. And after that, if we are accredited or not accredited, they will send a report whether accredited or not accredited. If it's a minor things, we can submit additional document in order to overcome this the comment. Okay, if accredited, then every year we have to submit an annual report. We have to send a report, complete report about the program. If there is any changes in the program, let's say changing of the nursing director or dean of the school of nursing, or changing of the program and everything, we should submit a report in order to inform the accrediting body that we have these changes, and they will monitor, and according to the percentage of the changes, they will come, either they will come to see the college, or they will just accept the changes without anything. So they are ensuring that we are adhering the standard and the criteria that's set by the accrediting body. The last remark, for any college or any program that they want to start accreditation, the accreditation is a journey of learning. Okay, it is a development process that we learn how to develop or to improve the quality of the program, and it is not a single stage or a single event. They come to visit and then we close everything. No, it is a sustainable process in order to achieve the quality of the nursing program, and having a good manager or leader. This will help us in overcome all the obstacles of accreditation and be ready for the accreditation team to visit. And finally, this is some resources that you could go through it, and very helpful in order to prepare for the colleges or program that they want to start in an accreditation process. It is at the first stage, the accreditation process is a little bit hard for the faculty, especially when you're going to generate all the data, all these forms, all the registration process. This is very hard. But as soon as, like us in the nursing college, when we start the first draft of that is the first initial accreditation, it was very, very hard because we don't have anything. But for the renew of the accreditation, it was much, much easier, and we have the process, we have the system, we have the documentation, we have the data. So we just added every year, we add new data for whatever they required. So, and thank you very much for listening. And this is my contact number and email. So if anyone interested, I'm willing to help you for accreditation process. Thank you for listening. Any questions you would like to ask?
Thank you so much, Doctor, for that very comprehensive presentation, especially for a program that is currently undergoing the process of accreditation like us. So
Yeah.
we know that it will take a lot of time and work, but it is really a journey, as you said. And
Yeah.
one of the things that I can interject is when you mentioned about the benefits for the students, because especially for those students, let's say, who will graduate from an ACEN accredited nursing school, and then they would like to, for example, study to the US. Typically, a student will have to go CGFNS. But
Yes.
because of the accreditation, the process will be easier for them,
Yes.
especially if they transition from a bachelor's to a master's, or from a master's to a DNP or a PhD.
Yes, exactly. When you have a credit program, it's much, much easier for the student in all role of the, especially if they are going to United States, it's much
Yes.
easier for them to get all the process very quickly and get accepted in the program. But if it's not, but our situation in Saudi Arabia, we still have in the infancy stage. And
Yeah.
I don't think it's applicable to us. Any student can transfer from one college to another college, and without any problem, any student can admit to the college. And if it is a new program or an old program, they don't, we don't have. Maybe after 10 years or 15 years, I think that the situation will change afterward, when every program is accredited, and we'll start to look which program is accredited first and what quality of the program. And that time we start to, even for the recruitment, the hospitals, they don't choose any student. They just, whatever the student arrived and submitted the application, they will accept them immediately without any looking for whether the program is accredited or not accredited. Maybe the situation will change afterward.
You're right, Doctor. Thank you
Yeah.
so much, Doctor. Because in terms of this area, I feel like you are the person who has a lot of wisdom, experience, depth of experience.
Yes, it is a teamwork. It's not individual person's job, and a good team, a good leader, having a good leader is very important in order to achieve the accreditation. It's much more easier. Because during our first initial accreditation, we don't have a lot of staff. At that time, we have only 12 staff. Okay, but no, the renewal, we have much more faculty.
Excellent.
Okay, so this is, faculty and staff as
You're
well.
inspiring us.
Thank you.
Well,
So
Doctor, yes, Doctor.
Yes, hoping that all the School of Nursing start to get accreditation, and either international or national accreditation.
Thank you so much, Doctor. But Doctor, I just want to add just lastly, because I do not want to miss this. Also, NLN now have their own accrediting body again. They established another accrediting body, the CNEA. It's actually the Commission for Nursing Education Accreditation. And just a few months ago, they already started also accreditation of international programs, which is very interesting.
Yeah.
Because the separation of from NLN AC, and then to ACN, which is controversial, as my mentor told me. So, and then now there is this new NLN CNEA, which is actually quite new also, that has a similar standards with ACN, but with a huge emphasis on caring. All right.
Yeah.
So, Doctor, thank you so much.
You're
And
welcome.
I would like to ask our participants if they would like to ask some questions, please. but I learned a lot from this.
Yeah, it's a hectic work. So I think the program have to start in order to think what are the problems they will face, and they will generate all the data. So good luck for everyone.
Thank you so much, Doctor. Our pleasure. Dr. Joanne, please.
Yes, Doctor. Doctor, there's one question here by one of the participants.
Okay.
She's asking, is national accreditation a prerequisite for international accreditation?
For the institution, the institute should be accredited first by the national accreditation. After that, the institute is accredited, then the program, they can decide whether they will go for international accreditation or national accreditation. This is not a must.
Yeah.
But you have to get approval from national accreditation body first. Then
Yes. This is mandatory now.
yes.
Anything, Doctor? You're one of the people there.
No, I'm not. Actually not. But for good information that the NCAA or the ETEC, they have developed a key learning outcome for certain programs. One of this nursing program and dentistry, I think medicine and laboratory, and they already finished the engineering and I think computer sciences. They already submit this one, but I think the nursing, they are approved already. They will send it to the colleges in order to implement it by all the programs in nursing, and to implement all these key learning outcomes. As
Yeah.
the school can add more additional learning outcomes. So this is more or less to standardize the outcomes.
Doctor, we hope that would not be an issue for substantive change. Just kidding. All right, Dr. Joanne.
I think there's no more question, Doctor.
Okay.
Doctor, I think there is one question. How could I ensure that one of our participants, how could I ensure that my MP program is accredited by the CCNE?
CCNE, they don't do accreditation now.
Yes,
International, they just ACN, they start doing the international accreditation. But rest of the accrediting body, they don't conduct accreditation for the outside the country.
Now CNEA also, Doctor, is an added.
Yes.
NLN, CNEA.
Yes, NLN. Yes, this is another body that started, because the original ACN is under the National League of Nursing. Then they separated because of their issue, and they separate the independent. They got accrediting by the own body of the National, I think, Education Program, and they started. They had to have the independent body.
Thank you, Doctor. Doctor, I have here another question for Dr. Munir. Our colleague is asking, yes, a question for all of the faculty actually. Is there a benefit for academic facilities for submitting to Saudi license? Dr. Munir?
Yes.
Yes. Doctor, the question is there a benefit for academic facilities for submitting to Saudi license or having a Saudi license?
Well, I think yes. From my point or from my view, I think it's really important for the academician to have the license, because they need to somehow connecting the clinical to the academia. So they might go supervising students in the clinical and the practicum, and they might also need to precept a student over there, because I don't know at this moment, but maybe later on, if we have clinical tracks for faculty, which we don't have at this moment, but if we do have clinical tracks for faculty, they would need to accomplish certain requirements in order to be promoted, and part of that is finishing specific clinical hours. So they will need it to be connected with the practice. They would need it to access healthcare facilities, and then maybe supervise students. We might not see a lot of restrictions when it comes to accessing healthcare institutions having a license or not. But speaking of the USA, I don't think any healthcare provider, any academician can go there, precept students or supervise students without having a license. So maybe at this moment, we don't have these restrictions, but on the other hand, we need it when we need to supervise the students, access the facility, provide some teaching, because this is really an evidence for them showing that they are certified, licensed, in order to provide, in order to practice. And part of the practicing is training, educating, etc.
Excuse me, I might add one point. If you're going for accreditation, international accreditation from ACN, it is required for all the staff to have the licensure from the Saudi Commission. This is one of the comments they have given us during the first initial visit, say that why are not the faculty are not accredited. And at that time, it was not obligatory. They want evidence that's showing that it is not required. But at the end, yeah, I think this is required now. So we have to request all the faculty now to get the accreditation. The most of the faculty, they have got the accreditation, especially who are mentoring or supervising the student in a clinical setting. So this is one of the
I would like to add something on that, because Doctor, a part of standard 2, I think that's a part of standard 2.1, 2.2, 2.3 in those areas, and these are one of the areas that we have consulted with Dr. Nell, who happens to be the director, because since we are undergoing the mandatory consultative visit, and most of the faculty members are expatriate also, and when we submitted the faculty profile form, it's very clear there that most of the faculty doesn't have the national license. So another recommendation from another consultant or some of the consultants also is when you drafted, like after candidacy and then you drafted the SEP or the SPE, is that would be a part of the strategies for further growth and development. So basically, it can be a target that is not met, that or partially met, that can be eventually will become met. So meaning, really the faculty members after candidacy, they really need to work hard to get the license as a part of the requirement.
Yes, exactly.
Thank you, Doc.
If I may add here also, because I see one of the comments about the Saudi Commission not allowing or not giving the option for the academician to renew the license if they don't have clinical practice. I think this is a gap really, because when we look at the nursing practice, it's actually not only the clinical practice. It's we moved away a lot from only looking from narrow lenses to nursing. Now we have nursing as a discipline, meaning that it is provided at the academician level, at the higher education level, and it actually have different branches. Part of that is the clinical side or clinical experience, but teaching is actually practice. Research is actually practice. Leadership is actually a practice. This is 101 nursing. When we teach them in the first courses at the first level, nurse have different, or a nurse has a different roles. Part of that is being researcher, part of that is being educator, part of that is being a leader. So if we cannot consider these as part of the practice, I don't think this is really a gap that need to be considered at the Saudi Commission level.
Very informative. Everything is just informative. So anything else that you would like to the participants to ask? Probably a last question, Dr. Joanne, before we close the event. Is there any question?
I think there's no more question, Doctor, aside from the suggestion from one of our colleagues to lobby it to the Saudi Commission so that the academicians can also apply for their license or have their Saudi license, Doctor.
I think there is a process, but I think this is not the avenue to discuss this. But I just want to say something, of course, before our dear colleague, Dr. Nermeen. I think Dr. Nermeen will have to say something before I also add something.
Yes, just a short summary, Doc, about because I will talk just a short summary about our talks today, our presentation from our valuable speakers. So I will talk about the power of advocacy because it is one of the code of ethics in our profession. As a nurses should promote and advocate for the patients and the right of our patients, and this cannot be achieved by just basic skills. As Dr. Delshad said, that the healthcare facilities should be distributed and should be distributed with high quality to all patients, to all of our patients. Also, Dr. Ilham focused on the importance of leaderships to adhere to the nursing values through innovation, empowerment, and to be expertise in the professional place through to be an excellent leader, which will probably, for sure, it will improve the patient quality. Also, Dr. Munir focused on the role of the advanced practitioner, and the advanced practitioner, for sure, it will lead to high quality of from the high competences of the nurses will lead to high quality of patient care and safe patient care also. Also, Dr. Munira said that we need to focus on the research, and also we need all the nursing schools to be accredited, and if it will be accredited, we will have advocate nurses to our patients, which will lead to high quality and safe patient care. Thank you so much for attending our event. I learned a lot today and yesterday, really. It was a great event. Really.
Dr. Nermeen, I would like to say something also first. In behalf of the College of Applied Medical Sciences and also our dean, Dr. Abdulrahman Al-Sultan, we would like to express our deepest gratitude for all the nurses who attended this virtual event, especially to our speakers, to Dr. Delshad, Ilham, Munira, Dr. Munir, and also Dr. Shadia, who are our colleagues and friends in the profession. We are so amazed by your passion disseminating diverse kinds of information, especially for our nurses here in Saudi Arabia. And we are like on a start of a revolution here. So we're truly blessed. We would like to express that we are truly blessed to came across all of you because all of the topics that you have discussed to us deserves to be heard, and its potential impact needs to be leveraged. So in behalf of the Department of Nursing, together with the faculty members as well, and all the staff, we hope and wish that your passion, or the passion that you bring in using the power of your unique voices, will amplify other voices, particularly the nurses who are listening here. And we are just so happy as always, and we are really looking forward to have you again, and thank you for infusing joy for all of us. We're grateful.
Thank you very much.
Thank you, doctors. Thank you.
Thank you very much.
So I guess guide the participants to do the evaluation.
Yes, doctor.
Yes, please fill up the evaluation form in the chat box.
Yes, we will be giving a copy of the evaluation also to our esteemed speakers as well.
For our dear participants, again, the evaluation form is already on the chat box. Please accomplish it. Don't forget to put your first name, middle name, and family name, and a working email. Please make sure that the emails that you will put will be working so that you would be able to receive the certificates. If you haven't followed us yet in Twitter, Snapchat, and Instagram, please don't forget to follow us to get updated for the latest webinars or any events that we will have. Thank you.
There's so many links, as you said. Sorry. And we will be having another one next week. Thank you so much, my dear colleagues and all the members here of the department. So we learned a lot.
If you're already finished accomplishing the evaluation form, you may already leave the session. We will give about 5 minutes for the rest of the participants to accomplish the evaluation form. And after that, we will be closing the session already. So please don't forget to do your evaluation for your certificates. And don't forget to follow us. Thank you.